Him to speak, we are told now, at around 11:30 Eastern, so a little later than usual, but we will of course bring that to you as soon as he comes out of his home, Rideau Cottage, to give us the latest on what his government is doing and how they are responding to COVID-19. Just last hour, though, in Regina, the leader of the official opposition, Andrew Scheer, criticized the government's response so far, saying it has been, quote, full of confusion and repeated delays. We will also take a look at what Toronto is doing to toughen up physical distancing measures in Canada's biggest city after some stark warnings from the public health officer in Toronto. As we look live now, we are expecting the Prime Minister to speak, as I said, around 11:30, and we'll bring that to you as soon as he emerges. First, though, let me bring in my colleagues who help with our daily coverage. Power and Politics hosts Vashi Kapelis and the CBC's David Cochrane. They are both here today. I guess let's start on what we expect to hear from the government today in terms of their response, Vashi.
So a couple of things. My understanding is the Prime Minister will focus on those remaining questions so many Canadians have where the wage subsidy is concerned. So that's the announcement the government made late last week about a 75% subsidy for wages for businesses. Now we know, as of a few days ago, of any size. We still don't know enough, though, about how a business will be able to qualify or what they need to qualify. Specifically, the Prime Minister had indicated on Monday, I think it was, that the business would have to show a 30% reduction in revenue in the wake of this pandemic. That might come after the fact, but that would be a qualifying factor. So there are still a lot of questions. We were going to get the answers yesterday from the Finance Minister, Bill Morneau. That didn't happen. It's being pushed until this afternoon. But my understanding is that the Prime Minister will reveal some of that. There's also some more questions about the CERB. They have said that's the sort of, I should say, the amount of money, the pile of money that will help individuals. So $2,000 a month for up to 4 months, sort of an alternative to EI if you've lost your job or you have to stay home because of the spread of COVID-19. There are still some questions about, do you have to have lost all your income? Could it have been some? That kind of thing. So qualifying questions there too. I am expecting some of those details to be provided by the Prime Minister once again. But I think set against the backdrop of what you described there coming from Toronto, stricter measures in Ontario as well. That is sort of overarching so much of what we're hearing from the federal government too. Questions about how strict these measures should be at a sort of countrywide level versus just the provinces, and how should we be interpreting that the chief public health officer for Toronto is saying we've got to get strict for the next 3 months. I think those are the kinds of questions that the Prime Minister will get. I think Canadians are interested to know at a sort of national level what that means for them.
Yeah, and we heard yesterday from British Columbia, for instance, that they expect this to go, well into, I guess, sort of summertime, end of summertime. We certainly heard from the City of Toronto today saying that these new measures they've put in place will last about 3 months. And I guess everyone's very preoccupied with that notion, understandably so. It's easier to do something if you know that there's an end in sight. We also saw some fairly strict measures from Quebec today. They are now putting Sûreté du Québec, their provincial police force officers at various points across the province, including at the bridges that connect Ottawa to Gatineau, to ensure that there's not too much traffic back and forth. Quebec at this point has more than 4,000 cases. So there's lots of things going on that indicate certainly a tightening up of public health measures, but also laying the groundwork, I think, for a longer period of time than maybe people are mentally ready to contemplate right now. David, over to you.
Yeah, Rosie, I think people need to start mentally contemplating that. I mean, right from day one, when the first aid packages were announced, at least in their initial form, the one thing that really hasn't changed from day one is that these were like for 14, 15 weeks. And that should give you a sense of what the government was anticipating, at the very least, the short-term economic fallout of this would be, as the entire Canadian economy has sort of been put in this medically induced coma. And now all the public health experts are backing that up with stricter measures and new enforcement restrictions to try to help slow this spread and stop the health system from being completely overwhelmed. So I think it's quite clear now, or it should be clear to people, that This is not a quick fix. This is a temporary solution, but temporary does not mean short. Maybe short in the life cycle of everybody, but not short in the immediate time frame. With schools closed in Ontario at least until May the 4th, and with schools closed in other provinces indefinitely, I think people need to wrap their head around the fact that we may not send our kids back to the school system at any point for the rest of this academic year. That is certainly where it is trending. So what we need from the Prime Minister today is answers to the questions that business groups, from small businesses to big businesses to the tech sector, are flooding my inbox with. Rosie, I'm sure you and Vashi are getting these too. What does it mean for me? How does the GST stuff work? What about this? What about that? What about? We need some answers to the whatabouts, because there are a lot of them out there affecting thousands of companies with hundreds of thousands of employees with no clear clarity of exactly how this works. Now, some of that is unavoidable because the government of Canada is essentially rolling out massive scale nationalizations of the country's payroll in like 72 hours. I mean, this is how fast this is moving. And the other question I think we need to answer, Rosie, is do they have to go back to the House of Commons to get approval to do this? This is the position of the Conservatives right now, that they think the government needs to recall Parliament, fly everybody back, go through that process, get the Senate back. I'm not sure what the tolerance level is for that kind of a parliamentary delay in the broader public, though it is important in a Westminster traditional parliamentary democracy to do these things. But the urgency for answers and, more importantly, for cash, that's not going away.
Okay, as we stand by and wait for the Prime Minister to emerge from his home there, I want to talk a little bit about some of the most vulnerable Canadians that are getting hit the hardest, and that is, not surprisingly, seniors' homes across the country now dealing with outbreaks in various provinces, some of them more tragic and more severe, depending on where you are. And certainly that is the case at Ontario's Pinecrest Nursing Home in Acadian. It is a huge concern right now. The 65-bed home has one of the deadliest outbreaks in the country. They are up to, I believe, 13 deaths, 12 residents and a volunteer. And Dr. Stephen Oldridge is an attending physician there, and he joins us now from Acadian. Doctor, thank you for making the time. I do appreciate it, sir.
Sure. Good morning.
So maybe just tell me, what is the latest on the situation at the Pinecrest Nursing Home from what you know?
Well, we're going to be giving daily updates. The medical director will be at 4 o'clock. We've been getting hourly updates on deaths, but we're going to release just the numbers once daily. This is a devastating illness. I can't describe just how quickly these people become sick. I think the message that needs to get out is there is no vaccine. We have no effective treatment other than supportive care for these folks, and obviously there's no cure. So when the infection takes hold in their lungs, in this elderly population, we can just make them comfortable. Realistically, a ventilator is not an option, unfortunately, for reasons the experts can lay into, but it's just heartbreaking.
And it is so prevalent in this nursing home. We've seen outbreaks, of course, in other parts of the country, in the Lower Mainland in BC, for instance. But it's so devastating there because the vulnerability of the patients, because there's no way to contain where people are. What's your assessment of why it has hit so hard?
Well, I think it's both. I mean, certainly they're the most vulnerable in our population. We knew this, as it was approaching our country, it's difficult to contain in these nursing homes. Where it's a family situation. This is a home. It's not set up as a hospital. We're not set up for isolation. To the extent that a hospital can offer. We can do our best, but it just, once it gets into one of these buildings, it's difficult to contain.
Do you have the resources that you need at the nursing home? And I do understand it is supposed to be a residential, environment, so it's not necessarily a medical environment.
We're getting support. We're getting support from public health. I think one of the biggest problems is public health has been operating on a skeleton staff. Prior to this pandemic, I think we could do more from a public health standpoint to manage these sorts of outbreaks. We need to be anticipating this sort of thing. So I don't blame public health, certainly, but I do think we can do more in containment efforts than what we've been able to do.
And I understand many of the workers have also gotten sick. How is that affecting the capacity to help the older people in the home?
Well, for the first several days, it was very, very difficult. We had people not coming in for shifts, and other staff staying for double shifts who were already exhausted. We're better now. Local organizations, province have stepped up and brought in some extra help from outside. But no, the home was overwhelmed, and that's another point. You know, our staff, our PSWs, are stressed. You know, we're stressed before the pandemic. You know. They don't have enough time to provide care. I think they're underpaid significantly, and then you throw in a pandemic, and this just displays the weaknesses to this underfunded healthcare system that we're forced to work in.
What about obviously there's no one coming in and out of the home, and that we've seen that sort of across the country, and people struggling to stay in touch with their family members. How are the residents that are there, even the ones who aren't sick, how are they managing being so isolated?
To be honest, I don't know. I can't imagine what it must be like for them. It must be frightening. You know, they can't get their family in, can't get the visitors in, the staff are run off their feet. We have family members outside their rooms through the windows, putting up pictures and waving and doing dances and the like, which gives them support. But, you know, it must be horrible for them, having to restrict visitors as we have been, but we have no choice.
You're an attending physician. You're a family physician. This is not the kind of work, I guess, that you would normally do. How are you doing? How are you coping with this?
Well, I'm not getting a lot of sleep. It's some of these family conversations are just gut-wrenching. But you know, I lay awake repeating in my mind, you know, what these folks are going through, and trying to support the families. I've been doing family medicine for 30 years and in nursing homes for all of that period. I've never had so many deaths in such a short period of time. We've been through influenza epidemics going through the homes and maybe lost a patient or two, but nothing like what we're seeing at Pinecrest. This is just unprecedented.
Can you tell me a little bit, without getting too deeply personal, about some of those gut-wrenching conversations, about how you even, you know, start that conversation?
Well, I'll get ahead of the news then. I know one of my patients died this morning early. I spoke with the daughter yesterday, and granddaughter, pardon me, and had to explain, you know, her mother was quite elderly, and you know, we would provide supportive care, and we did. She was comfortable to the end, passed this morning. You know, it's frustrating as a doctor. You want to do more, you want to help. I'm getting all these helpful emails and messages and Facebook messages from people. I had one this morning suggesting we use leeches. I've seen high-dose vitamin C, vitamin D. Donald Trump suggested hydroxychloroquine. I've had hot lemonade recommended. We don't have, as of yet, a proven and effective treatment for this disease. We certainly have lots we can do to support these patients and hope they can pull through on their own, but you know, there is no antiviral as of yet that is effective. I take my lead from the experts. I'm just a family doctor.
So we would now be up to 13 deaths of residents in the home, from what you understand.
Well, I will leave the official number up to the end of the day. I just told you about mine just for illustration, but you can expect more deaths, so it will continue. This isn't going to stop.
Are you safe when you go in terms of your personal protective gear? Do you feel like you are equipped to go into the home?
Well, it's a good point. There is, as you're aware, a severe shortage of personal protective equipment. I was in the home the morning that we found out that the outbreak we were dealing with was COVID. I was immediately self-isolated. I did have some respiratory symptoms and was on quarantine until I got my negative result 5 days later. I've been advised since by our hospital and medical director and others that I should only go into the home if there's been emergencies. So I haven't been back into the home, but I have access to the patient's charts on my computer remotely. I speak with the nurses by phone. We are just offering palliative care, and we can certainly do that remotely. So no, I have not been in. I would like to be in. I really like to be at their bedsides. This breaks me up not being able to go in.
What worries you the most outside of this particular center in terms of the pandemic across the country? What worries you the most as a doctor?
I'm worried about the other 24 nursing homes in Bobcaygeon that have COVID in their home. the health unit is going to have to work extra hard to contain this and hope it doesn't get through their home. The best treatment for this virus is prevention, is avoidance. So yes, restrict visitors and contain this as best we can. Pinecrest is just an example of how bad it can be, how bad it can get. We need to learn from the example and contain this as best we can. I've heard recommendations to take family members home, out of facilities. If you can care for your family member at home, do so if the health unit allows them to get out. It's certainly a safer place for them than being confined.
Doctor, I know medical professionals never like to feel like they're doing heroic work, but it is time like this when you are. I can see that you're struggling through it, but I think it's so important for you to speak to people. So, thank you so much for doing that, sir.
Thank you.
All right, stay safe, stay healthy. Thank you. As Dr. Stephen Oldridge, he's an attending physician at the Pinecrest Nursing Home in Bobcaygeon, Ontario, where he told us that as well as 12 deaths that had been reported, including a volunteer, he lost one of his patients overnight. So obviously this is the difficult part of this from a health perspective. These are the populations that are going to be hardest hit in this country, the people that have underlying conditions or of course are older and vulnerable, and as you heard there from the doctor, in places where they really are stuck, and so that makes it very easy for the virus to spread. Something to keep in mind every time we hear from public health officials about how important it is to stay home. The other part of the story, though, the other big challenge, of course, is the economic fallout from all of this, because it is as much a health story as it is an economic story about how this country is coping at a time when the economy is, for all intents and purposes, shut down. We know that the Canadian government, has announced this 75% wage subsidy, and we are expecting to hear a few more details today, both from the Prime Minister, who we continue to wait for there, but also from the Finance Minister, Minister of Small Business, and Minister of Innovation. They're speaking at 2 p.m. Eastern in Toronto. Let me go to Daniela Pervez. She's the co-owner of a private Montessori school in Brampton, Ontario, so a smaller business owner, and she joins me from her home in Georgetown, Ontario. Good to see you.
Good morning. Thank you.
So Daniela, what have you heard there from the government that you think might be of help from you? I would imagine your school is closed right now.
Yes, we were mandated to close as of March 17th.
And what have you heard from the federal government or provincial government that you think might be of help to you?
So as of right now, well, initially our staff members obviously were placed on EI because that was the initial response, right? Because it was a few weeks ago. We will be following up in terms of whether or not it would be better to maintain IEI, or if this other wage subsidy, if this wage subsidy will support, we'll be able to, we still have to learn as to what to do next. I'm always trying to keep on top of these things, but we will be following up so to do whatever is best for our employees.
So for now, what have you done with your employees? Have they been laid off? Have they applied for EI? And how many employees do you have?
So we have just under 30 employees. Most of them are full-time, and they were placed on EI on March 17th because we weren't able to open March 17th.
And would you consider hiring them back, as the government has suggested, to try and maintain that employer-employee connection, and then tapping into this wage subsidy, 75% wage subsidy, if you are able?
If we're able to, yes. In terms of the stipulation that we need to show a 30% reduction in revenue, well, we have zero revenue. Right. So we're not collecting fees, we have zero revenue. So we just need to learn more details at this point. And it's not that we wouldn't mind, as owners, doing the work for the employees and processing it. It's just a matter of learning more about eligibility and the process.
Do you have any, so I imagine you have no revenue coming in, because the Prime Minister talked about businesses that could topping up employees from the 75% to 100%. But in your case, would that even be possible?
Well, we have zero revenue. We don't even have revenue to pay fixed expenses, so we wouldn't have revenue to top up anything.
So you talked about fixed expenses. That's a concern lots of people have too, how they're going to pay their bills, how they're going to pay their rent or their leases. Are you considering, have you looked into the possibility of one of these interest-free loans in order to help you there?
Right. There is a $40,000 interest-free loan that we may be eligible for. We will be applying for it. So that will help with the expenses. Today alone, it's not all of our fixed expenses, but today alone we're making payments of $21,000 with no revenue. So, so that's just, and that's not even all the fixed expenses for the month. So yes, we are applying for the loan to see if it could be some help. But it's just a challenge because at the end of the day, even loans or deferred payments, anything like that, obviously is a challenge to be paid in the future. As a licensed childcare center, our expenses are very high on a good day.
Sure.
So to then pay, when we hopefully can get back to normal, that dollar that is going to be paid, we'll not only have to pay that existing month's expenses, but we'll also have to be covering deferred payments from now.
So reasonably, how long could you go on like this? Because, we are now thinking of timelines that are 3-4 months out.
At most, stretching 2 months, really stretching. And it's, the Prime Minister indicated yesterday that he didn't want, people to be coming out of this with an impossible amount of debt. And I can respect those words, but at the same time, if this lasts more than a couple months, I really don't see how that's even possible.
How are you coping in terms of your stress and your dealing with this mentally, because that's a lot?
So trying to manage a household with my husband and keeping our kids busy, and I don't have toddlers around my ankles, but teenagers are helping out as well, and between me and my sister, trying to keep to help out our parents as well, so they don't go out. We're just doing the best we can in this situation. Stress level is beyond imaginable, but you know what? We're healthy, and there's other people out there that are not healthy, and really everybody's health is most important. And we completely understand why funding has been focused on individual families and people in the community. There's no dispute there. Sure. We can completely appreciate that. We know funding is going where it needs to be going. It's just a challenge to be able to manage now. It's very overwhelming to be able to manage now, and then yet still be there in hopefully a couple months for our parents to return back to us, because they need to get back to work and the spots need to be there for their kids. Yeah.
Okay, Daniela Perves, I know you're coping as we all are, just doing our best, and I do hope that the Finance Minister has some more answers for you later today. That's at 2 Eastern, so tune in for that, and we'll come back and see how you're doing in a few weeks. Thank you so much for making the time.
Thank you very much. Appreciate it.
All right, take care. That's Daniela Perves. She's a co-owner of a Montessori school in Brampton, Ontario. We're told we've got about 2 minutes now until the Prime Minister comes out to tell us a little bit more. Oh, look, that was well timed. To tell us more about what his government is doing to deal with the COVID-19 pandemic. We will listen in now to the Prime Minister of Canada.
I want to start this morning by wishing everyone a happy Sikh Heritage Month. Every day, Sikh Canadians make our cities and our neighborhoods stronger. And right now, when people need help most, you're stepping up once again. In Regina, you're delivering supplies to your neighbors, while in Mississauga, you're donating to the Siva Food Bank. It just goes to show that we are all stronger together, supporting each other. You are doing your part, and so many others are doing the same. Aux gens qui sont aux premières lignes.
To the people on the front line, thank you. To our farmers and truckers, to the people delivering air cargo, to nurses and doctors. You are working 24/7 so that we can eat and take our medications. You are protecting our health and the health of our families. Your government is there for you. And we all say thank you.
Our government has introduced a 3-point economic plan to protect jobs, help people laid off, and support businesses. If you're worried about your job, we're helping your employer keep you on the payroll with the Canada Emergency Wage Subsidy. Later today, Minister Morneau, Minister Ng, and Minister Baines will provide an update about this 75% wage subsidy. But what I can say now is that it's going to be available for businesses big and small, that are not publicly funded and have seen a 30% or more decline in gross revenues. That includes everything from bars and restaurants to charities and nonprofits. Applications will soon open through the CRA. Like I said on Friday, this money is for workers. Employers will need to attest that they're doing everything they can to pay the remaining 25% of people's wages. These are unprecedented times and will require us to pull together as a country and trust each other as Canadians. So there will be stiff and severe penalties for trying to take advantage of this system and of your fellow Canadians. Notre subvention salariale de 75% est là pour les entreprises petites et grandes.
Wage subsidy is there for small and large companies that are not publicly funded and have seen a 30% decline in their revenues. That includes restaurants and bars, charities, and nonprofits. You will soon be able to apply on the CRA website. That money is for workers. Employers that use that subsidy have to do everything in their power to pay the remaining 25% of workers' wages. As I've said, we are in an unprecedented situation. We have to pull together as a country and trust each other. There will be very stiff and severe penalties for anyone who tries to take advantage of the system and fellow Canadians.
So we're taking unprecedented action. And while we put this measure in place, we're continuing to move forward on the other two prongs of our economic plan. To help business owners worried about rent or other bills, we've brought in new loans. To help people who lose their paycheck, whether they're freelance or have been laid off, we created the Canada Emergency Response Benefit. And on that front, I have some good news to share.
Starting on April 6th, if you have not yet applied for employment insurance, you can apply online to receive the Canada Emergency Response Benefit. That is available to everyone. But if you are receiving the wage subsidy, you cannot receive the Emergency Response Benefit. You can apply by visiting Canada.ca. And when you apply, you will have the choice of receiving your benefit by mail or by direct deposit. After that, all you'll have to do is to confirm that you are still without a job once every month. But again, if you have already applied for employment insurance, you do not need to register starting on April 6th. We are also taking measures to prevent the system to be overloaded by applications. Later today, Minister Duclos and Minister Qualtrough will have more details to share with respect to the process and eligibility criteria.
April 6th, you'll be able to apply for the Canada Emergency Response Benefit. A reminder, if you're getting the wage subsidy from your employer, you can't collect the CERB. It's one or the other. You can't get both of these benefits. For the CERB, you can register online at canada.ca. By selecting direct deposit, you should receive your payment within 3 to 5 days. If you can't apply online, don't worry. You can call the Revenue Agency for help over the phone. By mail, you'll get your check within 10 days. After applying, all you need to do is keep getting this benefit is check in every month to say that you're still out of work. And if you've already applied through EI, you're all set up. You don't need to do anything on April 6th. We're putting measures in place so we don't overload the system, but I can assure you that everyone will get their money. Later today, Minister Duclos and Minister Qualtrough will have more details on this whole process, from eligibility to applying to getting your check. But the bottom line is this: we're getting you the help you need when you need it. We have a plan to protect jobs, to help those who've been laid off, and to support businesses that are having cash flow problems. And we're not done yet. We're going to keep working hard to make sure you're getting the support you need. This is the largest economic program in Canada's history. So I've asked the House Leader and the Deputy Minister to reach out to the other parties about bringing back Parliament. This must be a Team Canada effort. Governments of all orders across the country are stepping up to fulfill their responsibilities to Canadians. Canada hasn't seen this type of civic mobilization since the Second World War. These are the biggest economic measures in our lifetimes to defeat a threat to our health. These historic measures will support Canadians to stay home to defeat COVID-19. But the government alone cannot win this fight. We all have to answer the call of duty. This is service that most of us have never been called upon to do. We, each of us, have to live up to our end of the bargain. We must fulfill our collective responsibility to each other. Listening to public health rules is your duty. Staying home is your way to serve. So be smart about what you do, about the choices you make. That is how you will serve your country and how we will all serve each other. How well we do this right now determines where our country will be in 2 weeks or in 2 months. It's in our hands. It's in your hands. On a tous un rôle à jouer.
We all have a role to play. We have a collective responsibility. Where we are in a few weeks or a few months does not depend on me, but on you. I am calling on your civic duty to protect others. If you do not follow the public health guidelines, you're putting others at risk. You all have a moral obligation to remain home. We all have a moral obligation to take care of each other. It is by working together that we will come out of this. It is by remaining true to our values that we will stay who we are as Canadians. Thank you.
Thank you. We'll now go to the phone line for one question and one follow-up. Operator.
Thank you. Merci. Première question, Michel Lamarche, TVA Nouvelle. À vous.
Good morning, Mr. Trudeau. This morning, do you consider that part of your responsibility is to be transparent about supplies of equipment? Can you guarantee us that there will be no shortage of PPE? The ministers were unable to do that yesterday. In this situation, we cannot guarantee anything. We are working very, very hard to try and meet the various needs, to ensure that the necessary protective equipment is delivered right across the country. And we are developing solutions right here in Canada to replace the equipment we use every single day in order to keep our healthcare professionals healthy. We will continue to work with the provinces and the various jurisdictions to meet all of their needs. But much of that depends on the choices that Canadians make now, how people behave today and in the coming weeks, and the choices that they make in terms of keeping this pandemic under control and being able to continue to protect the people who are working to protect us.
Follow up, Michelle.
There is a pressing need for surgical masks in Quebec. You heard that. Can you tell Quebecers or Quebec that your way of resolving this is to transfer part of the federal supply to Quebec. Yes, absolutely. The federal stockpile is there to help Canadians where they need help. I have spoken directly to Premier Legault. He pointed out the challenges that they're facing in Quebec at this time, and we will be there to work very hard to meet their needs. We are expecting shipments of PPE very soon, and we will be getting more as well. And we are going to be working on the resources to be made available here in Canada, and we will make sure there is no shortage in Canada. But of course, we understand it's a very difficult situation, and we will all have to do our part.
Thank you. Next question, operator.
Thank you. Merci. Next question, Mia Rabson, the Canadian Press. Your line is open.
Good morning. I'm wondering if you could explain why the National Emergency Stockpile didn't seem to help keep the equipment in the hands of health workers that we needed, and whether or not we're going to use the Defense Production Act in order to fill the need.
The Defense Production Act that we've seen in the United States is about forcing and ordering companies who might not otherwise do it to step up and produce the necessary equipment for a wartime or crisis situation. Here in Canada, what we've seen is companies across this country putting up their hands and asking to do it, offering any help they can right across the country to switch their manufacturing over to necessary goods, necessary equipment. We so far have seen such an overwhelming response from businesses that we have no need of bringing in at this point a similar act. But of course, we'll always keep an eye on what we need to do in future situations or how we can adjust. And the federal stockpile has been ensuring over the past weeks that there is enough equipment across the country to respond to the needs that the provinces have asked us for. On a vu
in the United States, they did decide to bring in the Defense Production Act. But in Canada, I can tell you that we have no need at this time to do that, because Canadian manufacturers and businesses across the country and plants all across the country have all been volunteering to help us to switch their processes to manufacture what we need. Now, of course, if we find we have a need to do that later on, we will do so. But for now, I can only thank all the different companies that have stepped up and offered to help us and who are working very hard to help their fellow citizens.
Follow up, Mia?
Yeah, I'm wondering if you could let us know what assurances you have from the Americans that they've dropped the idea of moving troops towards the U.S.-Canada border.
The ongoing conversations we have with the American administration continue on a broad range of subjects, and we have heard that is not something they're continuing to pursue, but we will, of course, continue to engage with the American administration as new situations come up and as things develop.
I can tell you that we continue to regularly speak to the U.S. administration on issues involving our border and critical trade between our two countries. For the time being, we have heard that they do not intend to pursue that idea, but we continue to have discussions with them.
Operator, next question.
Thank you. Merci. Prochaine question, Mélanie Marquis, La Presse. À vous.
Merci. Bonjour, Monsieur Trudeau.
Good morning, Mr. Trudeau. There is a shortage of medical equipment in Quebec, or there will be soon. How will the government help Quebec to resolve this problem? To reassure the Quebec medical professionals? Well, we are currently working very hard with the other provinces to see what options are there to help Quebec and any other regions who are in need of equipment. But we're also working at the international level to try and ensure that we can bring in additional equipment. For example, our ambassador in China is working diligently to follow up on this and get the material in that we have ordered. But the fact is that there are many, many countries that are running after the same equipment. And we are working hard and doing everything we can to ensure that nowhere in Canada will there be a shortage of PPE. But there's still a lot of work to be done. Can you tell me whether this will happen before the end of the week? And on another topic, Mr. Trudeau, there's a government document where it says that these the current measures will have to last until July or August. I can tell you that we are expecting to receive deliveries in a very short time frame, in the next few days or perhaps even sooner. And when it comes to scenarios, as I have said very often, we are looking at all sorts of different scenarios. It could last longer, it could last less time, and as I've always said, that will really depend on the choices and the behavior of Canadians every single day. How we keep ourselves safe, how we keep everyone else safe, the choices we're making, all of that has a direct impact on how long this is going to last. But looking around the world, even in countries like South Korea, where they were able to manage the crisis fairly well, those measures remain in place for a long time. And I think people have to expect that we will be facing this for many, many weeks to come, if not months.
Thank you. And one more question on the phone, please, operator.
Thank you. Merci. Next question, Eric Atkins, the Globe and Mail. Your line is open.
Hi there. Thank you. Given that Canadians returning from abroad are bringing confirmed cases of COVID-19 into Canada as recently as a few days ago, why are airlines and the government still bringing Canadians home?
That is a good but a difficult question. In Canada, we understand how important it is to keep Canadians safe. And we hope and are demanding that those Canadians who do return home self-isolate for 2 weeks. I know there are countries that have decided that people overseas or people elsewhere are not allowed to come home to Canada. That is not a choice we've made. We want Canadians to come home, but we also very much expect and demand that they keep themselves and their neighbors safe by self-isolating in rigorous conditions for 2 weeks as soon as they get home. We would much rather be able to have people home than have them stranded elsewhere around the world where things are getting, worse. Okay.
As a country, we made the decision to ask Canadians or to offer Canadians the possibility of coming back home if they're abroad. This is not the decision that other countries made. There are some countries or the citizens of other countries that are unable to go home. But we decided to bring home all Canadians because it's important for Canadians to be able to get back home where they are safer. At the same time, we have brought in very strict and rigorous measures so that people coming back will not put others at risk. Their neighbors, our healthcare workers, and so on. That's why it's so important that whoever is coming back to Canada from travel abroad self-isolate for 14 days to keep us all safe and to keep our healthcare workers safe.
And one follow-up.
I'm just wondering what the public health case is for allowing any Canadian to return.
The public health case is that if people who return properly and rigorously self-isolate, then we are not significantly increasing the risk to everyone else. It requires ensuring that they do indeed self-isolate, but in Canada, we try to look out for each other. That's been the characteristic of what we've seen over these past weeks. As people are there to help each other, people are making choices to make sure that they don't put themselves, their families, or their neighbors at risk. We see neighbors ensuring that food is dropped off to people who can't go out or are too vulnerable. We've seen volunteerism up extraordinarily, people calling up to volunteer as crisis counselors to go through the rigorous training to volunteer at Kids Help Phone. Canadians help each other when we're in tough times. And part of helping each other in tough times is making sure that Canadians who are stuck overseas can come home. But part of that responsibility that they have then is to make sure that they're not putting others at risk and make sure that they self-isolate.
Prime Minister Kevin Gallagher with CTV National News. Toronto's Chief Public Health Officer indicated today that these public health measures to mitigate the spread of COVID-19 could be in place for 12 weeks. There are, according to the National Post, internal federal government documents that also indicate these measures will be in place until July. You yourself have not shared these types of projections. Don't Canadians have a right to know how long these important yet disruptive public health measures will be in place for so that businesses can plan and families can plan?
We have been open and transparent with Canadians on the facts, and I've said from the very beginning that there are a wide range of scenarios that we have been looking for, that we're planning for, that we are trying to work towards as a government, as a country. We know that we are going to be in place for a number of more weeks, perhaps more months, but everything depends on how Canadians behave. The choices you make to stay at home, to self-isolate, to not go to 6 different stores when you go grocery shopping, to try to go grocery shopping only once a week, to be very careful to keep those 2 meters apart when you go for a walk, if you're allowed to go for a walk. These sorts of things are what will arrest the spread and the increase of this virus. We need all of us to do the best we can to make it through this unprecedented situation, and that's exactly what Canadians are doing. Nous reconnaissons
We recognize that it has been important every step of the way to be open with Canadians, and that's why we've been saying it could last for weeks or even months. At the same time, there are a range of different scenarios that we're looking at and for which we are preparing. But the critical thing here is Canadians' behavior. If Canadians make the right choice, if they decide to stay home as much as possible, if they keep a safe distance of at least 2 meters from others, if they try not to go to 8 different stores when they go out to buy food once a week, the choices that we are making and our behavior at this time will have a direct impact on where we're going to be in a few weeks and a few months. That's why we are here to support families and individuals, businesses. We are here to keep our economy stable while it is practically at a standstill so that we can recover quickly when we are able to. But that when is something we will know only in time. And as I said, it depends on the choices we make now.
Rather startling death projection released in the United States. Is there a similar projection in Canada? And if so, why have we not heard about these sorts of details?
As we've said, there are a range of projections depending on how Canadians are behaving, how isolation is working. I can say right now that the fact that so many Canadians are behaving in the right ways, are choosing to stay home, are choosing to self-isolate, are choosing to stay in their bubble, as Dr. Tam says, are choosing to not endanger themselves or their loved ones or their neighbors or our healthcare workers, is an extremely good sign. We are, of course, watching very, very carefully as the numbers creep up, as they arise more rapidly in different areas, and we will take the measures necessary to do everything we can to keep Canadians safe.
Radio-Canada, Mr. Trudeau, there are people who are home right now and they hear you say this may last weeks or months. There's a great deal of uncertainty and people are worried. Is it possible to have more specific information so that people are able to plan their lives over the next few weeks? Can we say to people that July is a realistic scenario? It may not happen, but it's a realistic scenario? Well, I can say it is a realistic scenario, but there are other shorter scenarios, there are other longer ones as well. We do not know. We know that we're trying to control the spread and flatten the curve, but it does not depend on a government. It depends on all citizens. And we are preparing and looking at a whole range of possibilities. It is possible that it will last a few weeks. It's possible it will last a few months. We will do whatever we need to do. First of all, two things. We will do everything we can to keep people healthy and also ensure that we have the ability to come out of this so that all Canadians have the resources that they need to remain in isolation as long as they have to. Mr. Scheer this morning proposed that the GST collected from businesses over the last 6 months be refunded to them. What do you think of that idea? Is that on the table? Well, there are all kinds of ideas coming forward from various sources, and we're open to any proposal, and we'll look at everything. Now, in terms of aid for businesses and particularly for workers, what we put on the table thus far are measures that represent the largest and the most unprecedented program in our history. This will help workers, this will help businesses, and there will probably be more that has to be done, and we will be there listening and looking at what we can do. We're always open to any suggestion, and I want to thank everyone who's making proposals. If that can help Canadians to come through this crisis so that we can recover and get back on our feet more quickly at the end.
With CBC News. You've been talking about the efforts your government's making to procure medical equipment, protective gear, and yet frontline health workers are still talking about shortages. So why is there this disconnect between the assurances you're offering and what frontline healthcare workers are experiencing?
We recognize the challenges that frontline health workers are facing in different parts of the country. We are working very closely with the provincial authorities in charge of those healthcare systems to try and meet the needs that they're faced with. We are looking at a global demand for these supplies that is unprecedented. Countries around the world are trying to get more of these supplies. We are expecting to see some shipments coming in very shortly that will help in Canada. We're continuing to work on more shipments in the coming weeks. And we are also working on tooling up our own production so that we can have made-in-Canada solutions for the coming weeks and perhaps months if that's how long this lasts. We are doing everything we can to meet the very real and pressing needs that we have in our healthcare system right across the country, particularly in some areas. And all I can say is that we will continue to work extremely hard to try and solve this problem because we need our healthcare systems and our healthcare workers specifically to have the protection they need as they keep the rest of us safe.
The Premier of Quebec was talking yesterday about supplies running out in 3 to 7 days. We've seen shortages in Ontario as well. So have you spoken specifically to those two provinces and offered them aid at this time?
We are offering all the help that we possibly can to all provinces, particularly Ontario and Quebec, that are facing difficult situations in terms of supplies. I can tell you that we are going to be receiving a shipment very soon of necessary equipment, and there are more to come in the coming days and weeks as well. We will continue to do everything we can to make sure that our healthcare workers get the support they need to be able to keep us safe. And we also, as I spoke about yesterday, have manufacturers stepping up so that we can have made-in-Canada solutions and we're not reliant on other countries as the world is looking for more PPE.
Prime Minister Janet Silver, Global News. The scientific literature is fairly clear on how mask use by the public can help cut the spread of influenza during a pandemic. And some countries are now making mask use mandatory across the board. Yet in Canada, the suggestion is that mask use won't really make a difference if you're asymptomatic. I'm wondering how much of a decision is based on the government wanting to make sure the public doesn't take masks away from healthcare workers at a time when there is a shortage.
Yeah, I think every decision we take needs to be based on the recommendations of our best science officials who are looking at everything from protection of Canadians to making sure we're protecting our healthcare workers. And on this issue that I know is an ongoing conversation amongst professionals and health professionals around the world, we're going to defer to our Chief Medical Officer, Dr. Tam.
But with all due respect, Prime Minister, if there are dissenting opinions in the international scientific and medical community on wearing masks for the public, if they are asymptomatics, do we not then owe it to the public to put whatever protective measures in place to protect them?
I'm going to continue to defer to Dr. Tam on this issue. I know there's much discussion going on that, and we certainly want to take the right decisions to make sure that Canadians are protected and that our healthcare workers are protected. Merci beaucoup tout le monde. Bonne journée.
All right, that is the Prime Minister of Canada with his daily update. Of course, we stand by and wait for federal cabinet ministers, public health officials, and at 2 o'clock Eastern, the Finance Minister of Canada to give more details. But let me bring in my colleagues, Vashi Kapelis and David Cochrane, before we hand things off to that press conference. Some critical details, I think, for Canadians there in terms of the emergency benefit measure. But I will say this, there was a lot of pressing of the Prime Minister to try and get a sense of timeline, which I think mentally would help a lot of people if they knew how long this was going to go on, but also because we do hear a little bit more now from other politicians and public health officers around timeline. BC saying, for instance, 0 chance of restrictions on gatherings being lifted before May, and Toronto suggesting now that this will go on for at least 12 weeks. The Prime Minister did not want to put any sort of timeline on it, saying that it will be weeks and months, but that it really depends on Canadians' behavior to know how much longer this will go on. Vashi, over to you.
Yeah, I wanted to touch on that because I do think it's a significant part of what we just heard from the Prime Minister. And I would start with the caveat that he's right. And that is what a lot of public health officials are saying, insofar as our behaviors right now will dictate the ultimate length of that timeline. However, there are other politicians and other public health officials, as you point out, Rosie, at different levels of government that are attaching various timelines to various scenarios. And even south of the border, last night, I played on my show a big portion of the press conference from the President of the United States, as well as Dr. Deborah Birx, who heads up sort of the coordination of their medical response. And they went into granular detail, presenting data to Americans about what they can expect under various scenarios. They said not just, physical distancing, but here's if we have full mitigation efforts intact in this part of the country, here's how many deaths you might see overall. Here's what the mortality rate looks like. Here's what it looks like without mitigation. And so I think that the questions are correct. I think that the government deserves some questions on this. The Prime Minister was very unwilling to sort of present. He admitted there are a variety of scenarios, and I understand that. I think Canadians understand that, but he did not want to put forth any data or any predictions based on those various scenarios. And I think as Canadians start to hear that from different levels of government or south of the border, they will continue to wonder and want the answer from the federal government as well. Just give us a sense, especially as you pointed out, for businesses that are thinking, I might only last 1 or 2 months. How do I plan for the probability that this could go on longer? I take the point completely that it is dependent on our actions right now, and that is a point that we have to continue to drive home. But I think that there is a genuine interest on what data the federal government has in front of it, and when we might be able to access that data as Canadians.
Okay, I should also say that those are all good points, and the Prime Minister has previously talked about making some modeling data available. I know that's very much reliant on provinces complying with that request, but it is something that he has said that they are willing to do. And I guess the other big headline with a minute left, David, sorry to do this to you, is that Parliament will be recalled at some point here.
Yeah, Parliament will be recalled to pass what is the biggest economic relief package in the country's history. That is the wage subsidy on top of everything that's been announced. But Rosie, very quickly, the timeline that is more alarming out of that news conference is what the Premier of Quebec is saying, 3 to 7 days before critical medical supplies run out. We know there are national stockpiles. We do not know if those have been depleted partially or entirely at this point. And when we ask specific questions on when is the reinforcements coming, in the coming days, in the coming days, in the coming days, it is not a specific timeline, which is what, if you're a doctor or a nurse or a long-term care worker right now, you need to know that, or if you're their manager and need to get them the supplies, the specifics on the delivery of masks and gloves and ventilators and everything else, that needs to become clear, because we are getting very clear alarm bells, most notably from Quebec right now, but also from some frontline hospitals here in Ontario.
Okay, thank you both very much for your coverage here on our special on CBC Television on the COVID-19 pandemic. More coming up on CBC News Network and CBC.ca. Hello and welcome back. I'm Rosemary Barton here in Ottawa. Welcome to our ongoing CBC News special, streaming live on your CBC News app or CBCNews.ca around the world. We are here, of course, with your latest COVID-19 coverage. Our big story now coming out of Ottawa. Just moments ago, the Prime Minister announced he will again call Parliament back to pass measures to help the Canadian economy through the pandemic. He called it the largest and most unprecedented economic program in Canadian history, and that's why they want Parliament to come back, because they realize the scope of this and the importance of getting all party support and all parties inside Parliament to vote on this. Earlier, before Justin Trudeau spoke, Conservative leader Andrew Scheer came out. He criticized the government's response to the crisis. We'll look more at that and also look at some of the measures Toronto has put in place as this ongoing conversation around timeline. How long are we in this for continues? Certainly in Toronto, some stark warnings from the public health officer of that city today, saying again that things are not on the right trajectory and that people need to stay home, whether they have COVID-19, whether they've been in contact with someone with COVID-19, and even if they haven't, that their restrictions, their movement should be restricted to really the grocery store and maybe a walk outside. Again, public health officers across this country calling on Canadians to double down on their efforts to self-isolate and really stay away from one another during this critical period. All right, as we wait for our federal cabinet minister's update, which will start in a few moments, let's get some reaction now from the NDP leader, Jagmeet Singh. He joins us live from Toronto. Mr. Singh, good to see you.
Good to see you as well.
So you just heard there that the Prime Minister wants to call back Parliament to get some broad approval, or at least have a conversation with the other parties about these measures. How do you feel about that?
We're ready to get back to Parliament at any moment's call. We know that Canadians need help immediately, and we know that the situation is very urgent. The measures that the Prime Minister has announced were welcome measures around the 75% wage subsidy, something that we've been calling for, and we think it would really help small businesses and, most importantly, people stay employed. Today's the first of the month, and I really am worried about how so many people across this country will not be able to afford their rent or their mortgage payments. And we really need to work with all levels of government to deliver immediate rent relief, and I'm hoping to put in place a pause on rent and a pause on mortgages during this crisis.
So it's not clear to me how the federal government would be involved in that. Every province across the country has now put in place eviction pauses so that people won't be thrown out on the streets. There are some provinces that have gone further, British Columbia, for instance, where your riding is, where there is that rental subsidy that will be given to renters. Banks have been told to defer mortgages. So I'm unclear what more the federal government could do on something that is largely a provincial jurisdiction.
Well, asking the banks to act nicely has not worked. The deferral system is not really helping people out the way it should. Under Section 91 of the Constitution Act, banks are federally regulated. There's a Banks Act as well that gives significant powers to the federal government. Mortgage payments and rent are deeply connected. If we can negotiate and use the powers that we have to make sure there's a pause on mortgages, it will significantly help in moving towards rent-free or pausing rent. So there's absolutely a role the federal government can play. There's significant powers under the Constitution, under the Banks Act, that the federal government can use. And using those powers, we can get to a point where we put a pause on mortgage and rent as well. There's certainly a role to be played by the federal government.
I mean, some banks have been deferring mortgages, but we have heard other places where it has become complicated, the criteria or the conditions. Not everyone qualifies for them if they're new owners, for instance, and those kinds of things. So what would be the stick the federal government could use then to compel the banks to go ahead with this?
Section 91 of the Constitution gives powers of regulation of banks to the federal government. The Banks Act, which is also federal legislation, gives significant powers to the federal government. Basically, what we need to do is enforce a very clear message using the powers that we have that there needs to be a pause on mortgage. Using that pause on mortgage, work with provinces to have a pause on rent. People cannot afford to pay their bills when they have no money coming in. There's so many job losses. People are struggling. We need to get to a point where there is a pause. Just for this crisis, a pause on mortgage and rent, we can get there. The Deputy Prime Minister said herself, this is not a time to fight about jurisdiction. This is a time to help people. I believe we need to help people, and here's a concrete way for us to do it, is to pause mortgages, negotiate with provinces, work with them collaboratively to develop a point where we get to pausing on rents as well. That's what we need to do.
How much the wage subsidy of 75% now applies to every company in this country that has lost 30% more of revenue? How quickly do you think that needs to be available? I guess Parliament will come back because it has become a much larger package than was initially anticipated.
Well, weeks ago, we acknowledged that the government was responding, but things had changed since their initial request or their initial proposal of 10% wage subsidy. And I'd called for at least 75%, as other countries have done. This is something that businesses need right away. Another thing that businesses need is, particularly in the service industry, the hospitality industry, they also need relief when it comes to their commercial rent and commercial mortgages. So we need to do a lot more, and I'm prepared to work with the government. There's some great measures that the Prime Minister has announced. There's a bit of a lack of urgency, though. To your question, we need to move quickly, and people need to have access to the wage subsidy, the emergency benefit. We need quicker access. I still believe the best way to get people help is a universal basic income, sending money directly to all Canadians. And those who don't need it, we can tax that back in the next tax cycle. But people need help immediately, and that is not really getting to the people in a way that respects the desperation that they're going through.
Okay, Jagmeet Singh, we'll leave it there. Thank you very much for joining us. That's federal NDP leader Jagmeet Singh in Toronto. Power Politics host Vashi Kapelis and CBC's David Cochrane are here, and we'll break down a little bit more what the Prime Minister said as we wait for cabinet ministers to come forward. You know, I take Mr. Singh's point that, yes, everyone would rather this happen yesterday, but I guess there was some confusion or a desire to have Parliament at least weigh in on this package. There seemed to be, you know, the Conservatives in particular who thought that Parliament did need to be recalled, and sort of as a measure of caution and a measure of collaboration, I would imagine the government is going ahead and doing that. But that also means that there'll be at least 48 hours now before they can organize to get people here again, to get some percentage of people here. That will have to unfold in a timely way, and it took a little bit longer than expected last time. So all these things take time, and the more time they take, that means the more people and businesses and employees are waiting. And that's, you know, that's a function of government, and certainly the government is operating at breakneck speed. But it is, I'm sure, frustrating for people who are waiting for help, who needed it, you know, 2 days ago, Vashi.
Yeah, I mean, we'll have to see what the timeline is for recalling Parliament, and if in fact that does end up impacting the delivery of these programs. The first program, the big one, being the CERB. So that's the money that if you've been laid off or if you can't work because of COVID-19, you can access. What the Prime Minister said today, the details that he gave us today, was that it had been anticipated that perhaps you could apply as early as April 6th. He sort of confirmed that will be the day that you can start applying, and that you'll have the option of asking for your payments to come via direct deposit or via mail, and that will impact the timeline that you get your money too. So if you're doing direct deposit, it could be between 3 and 5 days. It will take up to 10 days to get the money by mail. So there is, 6 days until that application process starts. And I'm sort of trying to find out when Parliament might come back. It sounds like it's to be determined. It could be as early as next week, but that will largely depend on some of the negotiations between all the parties' House leaders that are taking part as we speak right now. So if in fact they come back for one day, they enable the legislation to go ahead, and then the April 6th date, opens up. The timeline might not be too negatively impacted. It really just depends on how it all plays out. But those are the new details on the CERB that came from the Prime Minister. On the wage subsidy, some interesting information as well. Still no clarity on how the government will measure the 30% drop in revenue that it is saying you're going to need to show at some point, maybe before or after this all goes down, in order to qualify for that money. He says the application process, though, will be through the CRA, like the CERB benefit. So that's a new detail as well. And he also emphasized that businesses, employers should be doing everything in their power to pay the remaining 25%. So I don't know how significant that ends up being. Like, what does that mean for people who are applying? If they can't, how are they going to prove that? That kind of thing. So again, those details we are expecting for a little bit later today from the Finance Minister. Certainly those questions will be put to the Finance Minister. But as of now, those are kind of the new details that the Prime Minister revealed on those programs I know so many Canadians are interested in right now.
Yeah, and you're quite right. That is a really important piece of information. April 6th had been sort of the target date, and it does sound like that is, in fact, the date where you can start going on to that portal and figuring out how you're going to get the $2,000 a month if you need it, and so many people do. David, we are obviously we're tracking the story on a number of fronts. Again, I take Mr. Singh's point that today is rent day for many people, but I'm not really sure how much the federal government can do other than make sure people have some income, some money coming in order to pay it. This is very much a provincial jurisdiction. Certainly there can be conversations around that. It sounds like there have been. But beyond that, I guess it would be some sort of conversation with the banks who haven't been terribly compliant, for instance, on credit card interest rates. But beyond that, I'm not really sure that the federal government has an extensive role to play in rent and mortgage. Yeah.
They keep talking about the Team Canada approach, and that's really kind of what it would take, because I think my understanding is they could use the Federal Banking Act to force certain things with the banks, but then they have no capacity to force that flow through the landlord to the renter.
That's right.
And that's why you would need provincial legislation or some sort of provincial requirement through their rental acts to deal with this sort of thing. Or, people could be humane, and if the banks gave them a break on their mortgage, they could pass that on to their client, because everybody wants to have successful commercial and tenant relationships when this whole thing is over, and memories and grudges would be long if you are the unreasonable landlord in all of this, and it gets out. So a couple of other things that we got some clarity on today. Was that on the wage top-up, if you're a business, the Prime Minister telling us that it would be a simple attestation that you are doing everything you can to pay the wage top-up if you're a business. That's a little bit like some of the measures they're doing in the benefits that ordinary Canadians can apply for to get the $2,000 a month, that you simply have to swear and confirm online that you don't have a job, you don't have an income. And all of these programs seem to be being built, Rosie, with the philosophy of pay money first, ask questions later. They'll deal with any spillage or fraud after the fact, again with the stern warning that there would be severe consequences if anyone takes advantage of this. And also the point was made that specifically, the Prime Minister singled out that bars and restaurants would be eligible for this help. There was a fuss. Michelle Rempel was kind of driving at the Calgary MP because on Twitter the Business Development Bank of Canada, its website says it doesn't provide money to to bars or to people that only serve alcohol. Now, on that same page, it also said they don't do credit lines or zero interest loans. And guess what? They're about to be offering credit lines and zero interest loans. So those restrictions are kind of gone out the window. So assurance is there to people who sell alcohol as their primary source of business that they will be eligible for this, despite some now terribly outdated government websites suggesting that they wouldn't qualify for some of the help measures that are being offered.
probably more important to get the money out the door than update the website. But yeah, I take your point. Things are moving so quickly on a daily basis that it is the websites aren't always actually accurate, and that's why there's so many people emailing us for information. Yeah.
And government agencies are now doing stuff that they wouldn't have conceived of doing a month ago.
Yeah.
It's just the way this is. The Prime Minister called this the largest civic mobilization since the Second World War. That's why passport officers are now doing EI applications, and the BDC is going to give zero interest credit lines, to bars and restaurants in a way that they never would have done a month ago.
Okay, and as we've been saying, while we wait for this press conference to happen, there'll be another critical one if you are interested in this wage subsidy, and so many people I think will be. Those details to come at 2 p.m. Eastern. That press conference will be in Toronto with the Finance Minister, the Minister of Small Business, and the Minister of Innovation. In the meantime, Quebec, as we've been talking about, Quebec, who has a really large number of cases at this stage, is trying to clamp down as best it can on those outbreaks in various places, including trying to avoid all non-essential travel from one region to another. We've seen particular focus, for instance, in Montreal and the eastern townships, trying to limit people moving from anywhere else in the province to those zones. Well, now the province has gone one step further. It is putting Sûreté du Québec officers, provincial police officers, in different locations to make sure that nobody is doing that. And as we wait for these ministers, I think they're just filing in right now, actually. But let me go very quickly to Hilary Johnstone. She's on the Portage Bridge. That's between Ottawa and Gatineau. I've only got maybe a minute, Hilary, but tell us about these restrictions if you can do it.
Yeah, that sounds good, Rosie. As of right now, we don't see any restrictions on this bridge, one of the 5 links between Ottawa and Gatineau. As you can see behind me, cars are still flowing. What we know is that there are now 4 more regions in the province that are supposed to have these checkpoints, these travel restrictions. The Outaouais, so this region in western Quebec that connects with Ontario, is one of them. What we know is that this isn't going to be enforced on the Ontario side of the border. So police in Ontario say that they don't have plans to enforce this. This is very much something that's going to be happening on the Quebec side. We also don't know what sorts of penalties there might be for anyone who's found to be violating some of these new measures. That is still yet to come. The police here on the Ontario side are still asking people, though, to avoid all non-essential travel between the two provinces. We also know that there are a couple groups of people, rather, who are going to be exempt from this. Healthcare workers, humanitarian support, and anyone who is deemed to be necessary to keep the supply chain moving. Those are the sorts of groups of people who will be exempt from this ban. But of course, this is in an effort to slow the spread of COVID-19 and is essentially a travel ban into Western Quebec.
Okay, Hilary Johnstone, just on the bridge not far from where I am, with some extraordinary measures now between 2 regions that are very much linked. So we'll see how that unfolds over the course of the day. Let's take you now, though, back here to Ottawa. Federal ministers, public health officials are speaking. Here is the Deputy Prime Minister, Chrystia Freeland.
These tough actions are absolutely necessary, and I would like to offer my strongest support to the leaders who have taken these actions and to commend them. Il s'agit d'une semaine critique dans notre lutte.
This is a critical week in our fight against this virus. Canadians must continue to practice physical distancing, stay strong, and stay home, unless you do essential work such as stocking the shelves of our grocery stores or working in the healthcare system. You can go for a walk or for a run, but stay at a distance from others and wash your hands. I know that this is difficult, but Canadians are resilient, and I know that we can do this. All over Canada, leaders, like leaders in Toronto and in Quebec, are taking additional action to enforce physical distancing and to protect their citizens. These tough actions are absolutely necessary. This is true leadership. And I support these leaders.
We are going to hear from Canada's Chief Public Health Officer and her deputy, Dr. Tam and Dr. New. We are going to hear from our Minister of Health, Patty Hajdu. By video link, we are going to hear from our Minister of Employment, Workforce Development and Disability Inclusion, Carla Qualtrough, et le président du cabinet du Trésor.
And we'll hear from the president of the Treasury Board, Jean-Yves Duclos.
Bonjour, hello everyone.
Hello.
I'll start with my usual update on the number of COVID-19 cases in Canada. So there are now 9,017 cases, including 105 deaths. So in addition, at any point in time, as I've always said, there's many other people under investigation. Some are still waiting for their lab results. Some have not yet been tested. So again, even if you haven't heard of cases in your community, it doesn't mean that there are no cases and there are no exposures potentially there. Just act as though there's illness around you and act accordingly. So we've now completed tests for over 250,000 people in Canada, with around 3.7% of people confirmed as positive and 95% confirmed as negative. I just want to point to our website, which has a lot of epidemiologic information, lots and lots of data. And I'll just spend a moment in clarifying that there is such a thing as an epidemic curve that is posted on our website. And so every day at this point in time, you're hearing the cumulative numbers being reported, so that 9,017 is the total number of cases that we've had ever since the start of the outbreak in Canada. What you don't see with those numbers is when did these people get sick? What is the trajectory of this outbreak look like? And that's what an epidemic curve is, and that is on our website. So if you go there, and as I said before, what you're getting reported today is actually what happened to someone when they got infected and got symptomatic at least 2 weeks ago. So the numbers that you're seeing reported is what happened to someone 2 weeks ago. So you will see that the curve itself goes up and down, and the 2 week delay is, of course, when people get sick, they then have to go and present, they then get tested, they then get the test result, and it takes time for public health to investigate an outbreak, find the contacts, test the contacts. So it's quite an involved process to get you that epidemic curve. So look at it and you can see what actually is happening. Which is also why, when some of the key public health measures were put in a couple of weeks ago, we're not going to see the impact on the epidemic curve of those measures for a little while. But as I've said, this week is a crucial time, particularly in the West, where the epidemic started a little earlier, to see what's happened to that outbreak. And so I'll leave it at that, but obviously it's some of these technical pieces Dr. New and I could unpack for you at any point in time that you wish to ask us questions. So essentially, just to add the epidemic curve, we will not know where the peak of an outbreak is until you've actually passed that peak. That's another concept you need to remember, because this will keep going until you've actually got to the other side. You won't know that you've actually hit that peak. It takes a little bit of lag time. So right now, with the number of cases and outbreaks that we are seeing, they are still connected to a number of high-risk settings in Canada, particularly long-term care facilities. So there's still an urgent need to make sure and double down on precautions. For other high-risk individuals who are living in community settings, it is likewise important to take every precaution, which might mean staying in your home and getting support from others. So while many cases occur in adults, of the younger adults, it is really people over the age of 60 who account for 60% of hospitalizations and 93% of the deaths. So again, the high-risk populations need to take every precaution. And with so many Canadians practicing strict physical distancing, I'm heartened to hear the many stories about how people are staying connected virtually. Across all ages, physical distancing can put a strain on our mental health, with feelings of isolation and loneliness. It is important to remember that while we are keeping physically apart, we are all joined as Canadians in a vital collective effort to preserve health and save lives across our country. So please continue to reach out and find ways to connect and to support others who may be having a particularly difficult time. We all need to keep up physical distancing while maintaining strong social connections. What happens to that epidemic curve is up to every single one of us. Thank you.
Okay, thank you very much, Dr. Tam. Dr. New.
Oui, bonjour tout le monde.
Hello, everyone. There are currently 9,017 cases of COVID-19, including 105 deaths. In addition, at any point in time, there are many other people under investigation, awaiting laboratory results, or who have not yet been tested. So, even if you are not hearing of cases in your community, that does not mean that there are no cases or that there are no exposures waiting to happen. We have now completed tests for over 250,000 people in Canada, with about 3.7% confirmed as positive and about 95% confirmed as negative.
Dr. Tam
gave us a lot of detail, and I'll try to summarize in French. There's a lot of data on our website, and we welcome you to have a look at our website. One important concept is that of the epidemic curve. We give you cumulative data every day, but that doesn't truly paint a picture of today's situation. On our site, there are graphs that show how many cases are reported every day by onset of symptoms. And that type of data allows us to see the peak and see trends. We don't know whether we've yet hit the peak of the epidemic curve. It is so essential that everyone continue to practice social distancing, physical distancing rather, and then we'll see what the impacts will be in the upcoming weeks. There will always be a bit of a lag because the data that we get each day reflect the exposures that occurred 2 or even 3 weeks ago. When people contract the virus, they then take some time to fall ill and then consult for medical assistance, and then they get tested, and then the laboratory analyzes the test, gets the results, and then we trace contacts and manage contacts. So all of that takes a bit of time and is then reflected in the epidemic curve. With the number of cases and outbreaks connected to high-risk settings in Canada, in particular in long-term care facilities, there is an urgent need to double down on precautions. For other high-risk individuals who are living in community settings, it is likewise important to take every precaution, which means staying home and getting help and support from others. So many Canadians are practicing strict physical distancing, and it warms my heart to hear the many stories of people staying connected virtually. No matter how old we are, physical distancing can really put a strain on our mental health. It can make us feel isolated and lonely. It's important to remember that while we are keeping physically apart, we are all joined as Canadians in this crucial collective effort to preserve health and save lives across our country. Please stay in touch with others and keep finding ways to connect and to support others who may be having a very difficult time. We all need to keep up physical distancing while maintaining strong social connections. Thank you.
Okay, merci beaucoup, Dr.
Thank you very much, Dr. New.
We will hear from our Minister of Health, Patty Hajdu. Patty, please.
Well, hello.
I would like to start by thanking all those who are doing their part. I know that this is difficult, but we can't stop now. You are the first line of defense against this virus. Our government is trying to improve the situation.
We launched a new mobile app to help Canadians stay informed. The Canada COVID-19 app is available for free from the Canada.ca website, as well as both the Google and Apple app stores. This app will provide up-to-date information about the COVID-19 pandemic in Canada, including advice for preventing the spread of the virus, important contact information, and guidance for seeking medical help. And it includes a way for Canadians to check their symptoms on using the app. This app is just one more way that we can give Canadians information that they are seeking during this outbreak. We're going to continue to reach out to Canadians in any way possible so that we can work together to flatten the curve. And in the days to come, I will also announce a mental health digital toolkit that will help Canadians with the significant increase in distress that many of us are feeling in this uncertain time. I also want to reiterate the message that Dr. Tam has been sharing with Canadians. The number of COVID-19 cases being reported daily does not paint a full picture of what is happening across our country. It's important to remember that many people in all parts of the country are currently waiting on lab results, or they simply haven't been tested. So if you are not hearing about cases in your community, it doesn't mean that they don't exist. And for that reason, people must stay the course and practice social and physical distancing and follow the local and national public health advice, no matter where you are or no matter how many cases there are or aren't in your community. I know this is very hard, but I'm confident that if we continue to work for the common good, we can and we will weather this storm. Now, the important thing to remember is also to remain kind to one another. This time is difficult for everyone. This is the time to reach out safely. Call your loved ones. Write a letter to a friend. Volunteer safely to help those who are needing support. Our government will continue to work hard to have your back, but you, each and every one of you, can make a difference today in how someone is feeling. We must meet our fear together with courage. It will take courage to act with compassion. But it is by meeting fear with courage and compassion that we will get through this together and come out stronger on the other side. Thank you.
Okay. Thank you very much, Patty. Now we are going to hear from our Minister of Employment, Workforce Development and Disability Inclusion, Carla Qualtrough, and she is joining us by video link. Carla, please.
Hello, bonjour. I'm pleased to be able to join you and my cabinet colleagues today via video conference to give you an update on the Canada Emergency Response Benefit that was announced last week. Au cours des 2 dernières semaines,
the past 2 weeks, there has been an unprecedented wave of EI requests. 1.3 million EI requests have been filed. To put things in perspective, in 2018, 2019, 2.1 million Canadians received EI the whole year.
People from retirement and redesigned our systems. As I said last week, the reality is that our EI system wasn't designed to address the global public health crisis and its significant economic impacts. It doesn't cover all types of workers, particularly those with irregular hours and lower pay, often filled by Canada's most vulnerable populations, including persons with disabilities, youth, and new Canadians. Since the beginning, we've been unequivocal in our commitment to supporting all workers facing hardship as a result of the COVID-19 pandemic. That's why we announced the Canada Emergency Response Benefit. As we've developed our plans, our priority has been to ensure that Canadians can access this benefit in the simplest and fastest way possible. Today, we're pleased to let Canadians know that more information on how to apply for the CERB is now available online at canada.ca/coronavirus-CERB. And as of next Monday, April 6th, Canadians will be able to apply for the CERB. The CERB is being jointly administered by Service Canada and the Canada Revenue Agency, which will leverage the Government of Canada's 2 largest payment systems, allowing for more timely and accurate delivery of this important emergency benefit. Direct deposit payments will be made within 3 to 5 days of applying, with checks taking approximately 10 days. Cette page web sera mise à jour et servira de page principale
The web page will be updated often and will be an important place to get up-to-date information. And for Canadians who don't have access to internet or to a computer, they will be able to apply through Service Canada by phone. All those who will be eligible should open an account on Service Canada or with the CRA online before Monday.
Direct deposit in order to receive the benefit faster. For Canadians who have already applied for EI, there's no need to reapply. These applications will be automatically enrolled in the CERB. As I mentioned earlier, we've received over 2.1 million EI claims over the past 2 weeks, with more coming in each day. As of today, we've processed more than 430,000 of those claims. I'm pleased to report that in a space of a few weeks, Service Canada has developed and implemented a streamlined process that, starting today, will be able automatically to process approximately 400,000 applications per day. This means that the backlog of COVID-19 related applications will be addressed within the next week. This also means that some Canadians who have already applied through EI will begin receiving their CERB payment over the course of the next few days.
The public service is working hard to support Canadians and give them the help that they need in these difficult times. I would like to thank the public service and public servants for their hard work.
To support Canadian workers and their families. Merci, thank you.
Hey, thank you very much, Carla, and I am relieved the technology actually worked. Maintenant, je donne la parole au
Now, let's hear from the President of the Treasury Board, Jean-Yves Duclos. Go ahead, Jean-Yves. Thank you, Christia. Hello, everyone. And thank you for tuning in today. As you know, the COVID-19 pandemic is a public health crisis, an economic crisis, and a social crisis. This is an unprecedented crisis, so our government has taken major, substantial action to protect the health and safety of each and every Canadian. In addition to the measures that you're already aware of, that we've already taken, we want to ensure that all workers who are impacted by this crisis can quickly receive the financial support that they need to get through these difficult times. So we have implemented the new Canada Emergency Response Benefit. Our goal is to make this money available quickly so that Canadians can access it quickly and in a very simple, easy way. We want it to be simple and clear, and we don't want to leave anyone behind.
To get money into the hands of Canadians right away, whether they are not working because they are sick, have been laid off, have lost their income, or are looking after their children. Grâce à la prestation d'urgence du Canada,
thanks to the Canada Emergency Response Benefit, salaried workers and freelancers who are eligible will receive $2,000 every 4 weeks for up to 4 months. The Canada Emergency Response Benefit has been set up very quickly. This is a really unprecedented effort. Two government groups, the Canada Revenue Agency and Employment and Social Development Canada, are working together in order to deliver the Canada Emergency Response Benefit together.
That will be launched today. Canadians will be directed towards a service option that best fits their circumstances. The address is canada.ca/coronavirus-CERB. It is the same page for everyone. Demands will be accepted starting on April the 6th. La page web canada.ca.
The website is canada.ca/coronavirus-CERB. It is ready as of today, and so you can begin to apply for the CERB. You will be able to apply as of April 6th, but the website is already ready. We anticipate a huge amount of requests, so we ask Canadians to apply based on their birth dates. If you are born in January, February, and March, apply on April 6th. If you were born in April, May, and June, apply on April 7th. Apply on April 8th if you were born in
in July, August, or September and apply on April 9th if you were born in October, November, and December. And this process will have no effect on when you receive your benefit or how much you receive. The Canada Revenue Agency is working tirelessly on this benefit, and the Canada Revenue Agency will deliver this benefit using solid systems and counting on their dedicated staff, which is already the case for the 6 million Canadian families who are currently receiving the monthly Canada Child Benefit. Our government will support Canadians and businesses. We pledge to, and we need to get the right information out. So, in conclusion, we would like to thank journalists and thank the media for their great work in spreading important messages and information to Canadians. Each and every one of us has had to make sacrifices, but we will get through this crisis together. Let's continue to take care of one another. Thank you.
Hey, merci Jean-Yves, et on est prête à répondre à vos questions.
Thank you, Jean-Yves, and we're now ready to take questions.
One question, one follow-up. We'll take 3 questions on the phone and come back to the room. Operator?
Thank you. Merci. If you have a question, please press star 1 on your telephone keypad. Si vous avez une question, appuyez sur étoile 1 sur votre clavier. First question is from Alex Ballingal from Toronto Star. Please go ahead. Votre ligne est ouverte.
Hi, thanks so much for taking my question. I'm not sure, this one might be for Minister Hajdu and Dr. Tam. This morning, the Prime Minister was talking about a range of scenarios going forward with number of infections, I assume number of fatalities, length of time we could be existing under these social isolation and social physical distancing measures. I'm wondering if you guys can give us a sense of that range. What is the best case scenario in actual numbers of infections and fatalities and length of time, and what is the worst case scenario in those 3 things?
I'll start, Alex. Thanks for the question, and then I'll turn over to Dr. Tam for some specifics. That's the work we're doing right now, is some modeling work in terms of what we could anticipate given various measures that have been taken across the country by various provinces and local municipalities, as well as federal government actions. It's not as easy of an answer as I think it would seem, in that different ranges can be anticipated in different ways depending on the measures that have been taken, the effectiveness of those measures, when they've been taken, etc. So I'll tell all that to say that that is top of mind for us in terms of what we're doing at Health, because not only does it give us a way to accurately or more accurately predict what kind of surge we might see in different parts of the country, essentially important in terms of how we use our physical and human resources, but also what kinds of patterns of disease we might be anticipating given the different measures. And I guess the third important part, how might alleviating some of these measures impact our ability to control that curve or reduce the severity of future surges or future waves. So as much as I wish I could just give you a simple answer, there isn't one, but I will tell you that a lot of work is being done on that. I don't know if Dr. Tam has more that you want to add.
I think that's a good explanation, and really, together with the other chief medical officers, we've been looking at planning different scenarios, but all of us recognize that right now, how you influence the trajectory of this pandemic absolutely is dependent on exactly what we're doing right now. So it's to act rapidly. Even when we don't have all the information, we must act as we are doing now. In some respects, as we strengthen our public health measures over the last weeks, it also took a little bit of time for Canadians to truly pick up this message about physical distancing. So a lot of these measures were taken, just ahead of this, and so we really want to make a massive effort, because the length of time you could be into this epidemic wave is all dependent on what we're doing right now. So And scenario planning is actually quite simple on a piece of paper, because all you have to do is do a set of attack rates at the top, mild, moderate, severe on the other side, and give you a number. Is not that helpful for us right now. But we have been doing that exercise, and but we really want to focus our attention on getting this first wave under control. Let's just say that, just to add that, any planning scenario has us potentially overwhelming our healthcare system. So as I've said, part of the exercise so that you free up some of the hospital resources and ICUs, purchasing extra ventilators. But the really difficult message, I think, to Canadians is that on a whole range of these scenarios, this health system isn't well designed to cope with it if we don't do something about it now. So it doesn't matter which number you plug in, that's the truth of the matter. It is an extremely serious situation. You've seen how this is played out in certain areas of the United States. None of those scenarios are a good one. You've got to do something about it now.
Thank you, Dr. Alex. Follow up?
I just want to make sure I understand what you're saying. You're saying that in the range of scenarios, none of them are good, as in we're looking at a surge that could test the capacity of our healthcare systems no matter what?
Absolutely. That is the bottom line. Everyone's trying really hard, as I say, to move the health system resources so that you can cope with what it might be an upcoming upsurge of patients. People have looked at alternative care sites, absolutely trying to expand the current health system, the health workforce, in order to cope with this. So I do believe the health capacity, compared to what your regular day might be before this pandemic, has been freed up quite a bit. But still, even if you looked at some of the lower attack rates, it is not something that we want to see. So public health on the other side is trying to suppress the curve while the healthcare system is trying to increase its capacity. So I think if we can suppress this initial curve, we believe the health system right now is coping. So when we're looking at the fatality rate at the moment, we know that that is an unstable number because some people are still in a very critical condition. But the percentage of fatality is hovering around that 1%. In some areas where you hit a particular geographic location where there's a lot of people in long-term care facility, you get a higher case fatality rate. But the health system is actually coping quite well at the moment. But any of those bigger projections, when we look at the worst case scenarios, your health system will not be able to cope. It's about now doing really fast. But it is fundamentally, in the end, some very difficult decisions may have to be made about the prioritization of existing resources. So that's some of the really critical work that's being done in the health system right now.
And Alex, I'll just end by saying that health systems were never designed for this kind of surge. And so that is the challenge. And I think if Canadians can take anything away from what Dr. Tam has said, it's something that she said over and over and over, that our individual actions is the strongest tool we have to protect our healthcare system. Because this is a sneaky virus. We may feel very mildly ill. Some people don't feel ill at all. And that is why the social distancing and the physical distancing is so critically important, because an assumption that you're well and therefore are not posing a risk to somebody at the grocery store or posing a risk to your neighbors while you have a drink on the patio as things warm up is the wrong assumption to make. We have to all act as if we are carrying this virus. And that doesn't mean that you can't go for a walk, but it means that you do keep 6 feet of distance between yourselves and the other person next to you on the sidewalk or in the grocery store, and that you limit your socialization to the members of your household. This is a really hard message for many, many Canadians, and I know that. And I know there are circumstances out there that are very difficult. But ultimately, at the end of the day, our neighbor's life depends on us taking this seriously, because because ultimately, at the end of the day, our health system cannot cope with the surge. It was never designed to see that many critical patients all at once, nor would any system around the world be designed, as we have seen from countries all around the world try to get ready for this surge. And so Canadians play a very important role in keeping their neighbor, their loved one, their relative alive.
Thank you, Minister. Opératrice, prochaine question.
Thank you. Merci. The next question is from Hélène Buzetti, Le Devoir.
Question, Hélène Buzetti, Le Devoir. Go ahead. I have a question for Minister Duclos. Could you give us some more information about the difference between the 75% wage subsidy and the Canada Emergency Response Benefit of $500 per week? If you have a salary of $35,000 a year, $675 a week, well, the wage subsidy is then more advantageous. Your government seems to be saying that in both cases, the employment relationship with employer and employee is maintained, and in both cases, Canadians won't have to go to work to receive these benefits. So, why would Canadians request the emergency response benefit when they could prefer the wage subsidy? Answer. Thank you for your question. We absolutely want employer-employee relationships to be maintained. We want this because these relationships are very important in the short term, especially if there is a gradual return to work of employees in Canada. But it's also important because we want to get the economy rolling strongly again, and so we want to maintain these employment relationships. We have two goals. Our first goal is met by the Canadian Emergency Response Benefit and by the wage subsidies that we have announced and that we are giving you more information about today. Whether businesses can pay their employees' salaries or not in the upcoming weeks, there will be $2,000 a month available for all workers. Next, in many cases, we expect that businesses will continue to pay their employees' salaries above and beyond the $2,000 of Canada Emergency Response Benefit, and that's where the government's 75% wage subsidy comes into play. Ministers Morneau, Minister Ng, and other ministers have given us more information about how the wage subsidy will take effect.
My question would be for Minister Hajdu. It's regarding the stockpile. We hear that Quebec is almost facing a shortage of masks. So I just would like to know how many in the stockpiles can be sent right away to Quebec, and how much, what percentage of the total overall stockpile does that represent, and when will that be sent?
Thank you. I don't have the numbers for you in terms of percentages and total numbers in the stockpile, but I will tell you that there is a deputy minister table working right now on an allocation that is based on actual need. We know that all hospitals are in need of personal protective equipment, and the provinces and territories are working with the federal government to develop an allocation process that really gets at making sure those products are going to the areas in the country that are experiencing the surges right now, so that we can do this in an equitable way and in a fair way that makes sure that Canadians and the healthcare workers that are serving those Canadians have their needs met in a way that's going to actually make sense. This is difficult work, as you can imagine. Every province and territory is working to build up their own stockpiles for what may come in the days and weeks to follow, but I have confidence in our officials that the process that they're working on with ministers of territories and provinces is a fair one. I spoke to all of my colleagues last night on our weekly FPT call, and that work continues.
I'd like to add something. Minister Anand made an announcement yesterday. She announced that the federal government has begun to purchase 60,000 masks. Today, we ordered 5,000 more masks. As Minister Hajdu said, Minister Hajdu is working closely with her counterparts in all of the provinces We understand that the situation in Quebec is especially difficult right now. Last night, I spoke to Minister Sonia Lebel, and we talked about the situation.
Thank you, Deputy Prime Minister. Last question on the phone before we turn to the room.
Thank you. Merci. The next question is from Mia Rabson from the Canadian Press. Please go ahead. Votre ligne est ouverte.
Hi, my question is also about the stockpile. I know we've been asking this question a lot, and I just don't think we've got an actual answer. How big is the stockpile? And if we have a stockpile, why are we hearing from doctors, from nurses on the front lines that they do not have enough? Did we not have enough in the stockpile? Have we not started distributing anything from it?
So I don't have the exact numbers because the numbers change, as you can imagine, day to day as we dispense equipment across the country. To your question about whether we had enough, no, we likely did not have enough. I think federal governments for decades have been underfunding things like public health preparedness, and I would say that obviously governments all across the world are in the same exact situation. It is an extremely competitive space right now for personal protective equipment. We are pulling out all of the stops, as you have heard from our Prime Minister, from the Minister of Procurement, from the Deputy Prime Minister. We are working, I would say, 24 hours around the clock trying to procure equipment in a global situation where equipment is extremely tight. I have heard those stories myself from frontline workers. I know provinces and territories are developing different sets of rules for frontline workers around the disbursement and use of personal protective equipment, but I will tell you that we will not stop this work to get the PPE that we need. And I would say that this is an opportunity for all governments to consider reinvesting in public health and preparedness, and I look forward to those conversations on the other end of this. But I will tell you that the situation right now is such that our government has the money, we have the will, we have the workforce, and everybody's focus is firmly on getting PPE, and we will continue to fight for Canada's shares in that available stock as it comes online. Secondly, I'll say that the work on domestic production is incredibly important, and I am very, very, I feel very, I would say, I feel very warmed by the effort of Canadian companies that have reached out to me personally. I know reached out to many other members of Parliament, many other ministers about their efforts to retool. The reason why it took so long to find that word is just there's a feeling of warmth when I think about the effort of Canadian companies that are putting everything into trying to turn their manufacturing processes around as quickly as possible to create the things that Canadian frontline workers need. And we're going to continue to support them. The work that we're doing on making sure that we can accelerate regulatory processes, for example, to get these products created, to make sure that they meet the specifications that healthcare workers need, that frontline workers need. This is all work that's happening literally around the clock, and I'm incredibly proud of my colleagues who are working so hard on this. So thank you for the question.
Thank you, Minister. Next, we'll turn to the room now, starting with Julie, CBC.
Van Dusen, CBC. Just wondering, it could be for Ms. Freeland or Ms. Qualtrough. Could you explain to Canadians in a really simple way, the House of Commons was here last week to pass a benefits package. Why do you have to come back? Is there a problem? What has to be fixed? And is it going to delay people getting the money they urgently need?
Why don't I begin there? Because the Prime Minister, as he said today, has asked me and the House Leader and Jean-Yves to work with the opposition about a return of the House. This is really because we understand and value and respect the role of the opposition in our parliamentary democracy. It is so important for Parliament to play its role, to have its voice. We have seen that as we have been doing our work to get the support to Canadians they need, our work on procurement, our work on supporting Canadians as the economy is feeling the impacts of the coronavirus. And the Prime Minister has judged, and I 100% agree with him, that the magnitude of the measures that we know are necessary means that it would be a good idea to bring Parliament back to work on them. I would also like to say we are very much hoping and trusting, and I really believe that the opposition in the House will work with us in the spirit in which we are working on these issues, which is understanding that now is not a time for partisanship. Now is a time for a true Team Canada effort as we collectively rise to a challenge which can only be compared to the national challenge we faced in the Second World War.
Question. You didn't say why you're coming back, what needs to be fixed, will it delay the payments?
I think I did, Julie. I said that the Prime Minister believes, and I agree with him, that it is right and proper for us to be consulting with Parliament and working with Parliament given the magnitude of our measures. And you have heard from Carla and from Jean-Yves our plan to urgently get the payments out to Canadians because Canadians need them desperately, and we get that.
No delay.
Second question is for Dr. Tam. Thank you. It's a kind of a double whammy. Do you have enough tracking methods to track? And also, with this surge coming, apparently, how are doctors going to decide who gets a ventilator? Are there guidelines, and what are they?
So I think
Contact tracing. Contact tracers. Do you have enough? And what about the ventilators?
Contact tracing. Okay, got it. So one of the absolutely most important thing to get this first wave under control is not just case detection, but contact tracing. So that is a massive topic and amongst the chief medical officers. So I've been having these discussions very sort of intensely to make sure that there's enough capacity, public health capacity, to do the contact tracing. So the majority of jurisdictions actually have for now, but a few have said, look, if the cases go up in the next couple of weeks, we're going to need some help. So what we've done is at the federal level, we'll be providing that kind of support as needed by recruiting students and other human resource in order to provide that support to the provinces. Many of them have actually done a lot of this preparation already. They've recruited medical students, they've recruited other retired health professionals. Alberta has a good training module already done to get people trained on contact tracing. And many people have come up to say that they can help with that. So, but that is such an important question. And if anybody needs any help, we're here to provide that surge capacity. So that's one. And in terms of the second question, could you just remind me?
Ventilators, how do you?
Okay.
Doctors are going to have to make some difficult decisions. You were mentioning that a little earlier. So who gets a ventilator? Who doesn't? What guidelines are they being given?
Yes, so there are existing guidelines, and certainly in pandemic planning, we have ethical frameworks that we previously looked at. What I can tell you is that in different jurisdictions, they actually have guidance on how to prioritize. It's a very, very difficult decision in terms of making those decisions. So you will, if you reach out to Ontario, for example, their hospitals, their intensive care specialists, their ethicists, and others have come together to provide those difficult guidelines, and they are well laid out so that people are ready to potentially have to make those decisions.
Thank you, Doctor. Just a friendly
Some
reminder.
of those factors and underlying medical conditions, and there's a whole host of considerations. Yes.
Thank you, Doctor. So just a friendly reminder, one question, one follow-up, a clarification is a follow-up. Be mindful. Thank you. Mike, Global.
Why, hello. So scientific research or literature is clear on that masks reduce the pandemic. But we're suggesting to the public here in Canada that we don't give them these masks, we keep them away from them. Is this because we are prioritizing the healthcare system and the shortages there? Or what other reason would it be that we wouldn't want the public to go out and have these masks?
So I'll start, and then I'll turn to Dr. Tam. I think, first of all, the premise that the science is clear is not accurate, but I think there are obviously growing thoughts around the use of masks for general public wearing. Certainly, Dr. Tam's been keeping her eye on that science and giving us advice in terms of our own messaging. But yes, it's absolutely critical that if people are wearing masks outside, and it certainly is their prerogative to do that, by the way, that we're not taking away masks that are surgical or specialized that are extremely necessary on the front line, and that we're not using masks in a way also that are not appropriate. So, for example, most people don't realize, most general public doesn't realize that N95 masks just put on don't necessarily provide a greater level of protection. They have to be fit tested, which is a long process that I won't describe right now. But ultimately, at the end of the day, an N95 doesn't provide you additional protection if you're not using it properly. Dr. Tam has also been really clear that when we put face masks on and off, that we can unwittingly infect ourselves, or we could have a false sense of security that we have a mask and therefore be touching our face more and all kinds of things. So that's to say, all that to say that it is a personal choice. And if people feel that they want to make a cloth mask and wear a cloth mask, that is perfectly within their purview, and it wouldn't be up to me to determine that they shouldn't. But we do need to protect medical masks for medical professionals and other frontline workers who need them in the course of their everyday duties. And so that's the Minister of Health's perspective. I'll see if Dr. Tam has an additional comment.
Yes, I think the number one sort of concern of the health system is that the supply of medical masks, respirators must be preserved for health workers, those who are looking after patients. So that is probably the number one reason for making sure that the public understands that. We also know what actually does work already, which is physical distancing. Those droplets fall a certain distance. That's why we've been recommending the 2-meter distance. That actually works. Frequent hand washing absolutely works. Not touching your face are absolutely proven measures, and everyone should practice those regardless of what else you're adding to those layers of protection. And so then the use of what I might call non-medical mask or other materials. I think I got asked this question maybe a couple of days ago by asymptomatic people just going about in the community. On the one hand, might potentially reduce you from touching your nose and your mouth. Like if you covered off those parts, but you have to be really careful you're not then putting your finger in your eye, or when you're pulling your mask on and off, that you're touching your face in other ways. So that is one aspect of it. I actually do sort of, if you had a fabric or homemade mask, it's a way of covering your cough. We've always said you should cover your cough so that you're not throwing your droplets around to someone else or on a surface, for example. So it's a way of protecting others in a way. When we go, if you didn't have a tissue, you cough into your elbow, a mask kind of acts as that kind of a barrier, if you want to think of it that way. The effectiveness of the use of non-medical masks hasn't really been well demonstrated, but I think that there may not be any harm in wearing it, as the minister said, if one uses it properly. It's not gaping, it's fairly well fitted, and you really practice good hygienic measures before and taking them. You have to wash your hands. But I would say that absolutely, no matter what you do with that kind of a covering of your nose and mouth, you have to practice what we know works, which is that physical distancing, hand washing, and not touching your face. So I think I've always said that, from a public health perspective, we need to take in evolution in information and science, and we've been doing that. And these are the kind of things that we discuss as a community of practice in terms of the public health and the chief medical officers.
I think you mentioned this the other day, but just to clarify, when would someone in the public, because of the shortages, would you recommend that they have a mask or something?
So certainly, if you are a group of persons who actually have the illness, so you have COVID-19. You've been asked to self-isolate because you may have been exposed, and then you need to actually get yourself someplace to the actual clinic or where you're directed to go for essential appointments or other places, then is covering up your cough, covering your mouth. Sometimes maybe your symptoms might be very mild. You may not know whether you're developing or not. Under those circumstances, covering your mouth does prevent your droplets from being transmitted to others. So still, it's people who are symptomatic who may have the illness, but we do recognize that sometimes people have very mild illness or that they may not even recognize they're beginning to develop the illness. So people in the incubation period.
Thank you, Dr. CTV.
Ian Wood, CTV News. Minister Freeland, rent was due today for many Canadians, and many Canadians probably couldn't make their rent. While the government's going to provide $2,000 a month, that check is not coming for days still. And even when it does come, in many cities, $2,000 a month isn't enough for rent. And while it might be a provincial municipal jurisdiction, why hasn't the government stepped in at this point where it's helped homeowners, but it's not helped renters?
So that is a really good question, and it's something that we are very preoccupied by and focused on, both inside our own government and in our conversations with the provinces, many of which have taken real action on this front. And I do want to be clear that in this crisis, we are never going to quibble about what is a provincial responsibility and what is a federal responsibility. We believe and understand that the federal government has a responsibility to all Canadians and that the federal government has to provide leadership to the country. This is a really big economic challenge. And it is a huge health challenge. And so the way we have structured our work is to start with the health and safety of Canadians, to begin literally with the life and death issue. And that is 100% the right thing to do. And that is overwhelmingly the center of our work. Next has come an effort to do everything we can to help Canadians weather this economic storm and to ensure our society, our economy are able to come roaring back when the crisis is over. And we started in exactly the right place, which is doing what we could as quickly as we could to support individual Canadians, and that is what we have been hearing about from Carla and Jean-Yves today. The CERB $2,000 a month for people who can't work because of coronavirus or who have lost their jobs because of coronavirus. The Prime Minister announced just last Friday another huge step, which is the wage subsidy program. This is the biggest economic program the Government of Canada has ever put into place. I want Canadians to really understand the magnitude of it. And that program is focused on keeping companies afloat and maintaining that essential connection between employers and workers. So important so that we can go back to work when this is over, and so important psychologically for people. And that was a huge, huge thing. Exactly the right thing to do next. The third thing, which we have done already, is provide huge liquidity support to banks and to the banking system. Also extremely important, and I really want, and you know, that has been the work of our government and of the Bank of Canada. That is in place. Have we done everything that needs to be done? Absolutely not. Are there outstanding issues? 100%. Are we focused on them? absolutely. When it comes to the specific question of rent checks being due, in addition to some concrete measures that we have seen taken by provinces and cities, which I commend, let me just also say to all of the landlords across the country, you have a responsibility too. In some places, eviction is not being permitted during this crisis, but whether or not that applies to you specifically, we are all in this together, and it would be a heartless act indeed to evict someone right now, given what we are all going through. Now, it is the case that for some landlords, they need to make mortgage payments, and they rely on rent to make those payments. And again, there, we have been working with the banks and have taken some concrete steps to give people some breathing room.
Quebec today announced that they're going to put in checkpoints at interprovincial borders, including the ones that are not 5 minutes walk from here into Gatineau. Time and time again, we've been told with regard to measures, whether they be closing the U.S. border or closing restaurants or whatever that might be that we're now doing, that when we've asked about them, we're not quite there yet. And then we have gotten to that point. Like Gretzky says, you go to where the puck is going to be and not where it is. So is this the time now with Quebec closing it, or not closing, but putting in checkpoints? Is this the time now for the federal government to start limiting domestic travel?
Ian, you anticipated the metaphor I was going to use. I think, well, look, I grew up in northern Alberta, so I am 100% a Wayne Gretzky fan, and that notion of skating to where the puck is going to be has actually been a guiding principle for our government. Quebec has taken some strong measures today. The province of Quebec has our support and admiration for showing real leadership there, as does the City of Toronto, which introduced some very significant measures today. Those are exactly the right things for Canada's biggest city. And again, I would like to really commend the leadership that John Tory and Dr. Eileen de Villa have shown. We have heard some very sobering messages from Dr. Tam and from Patty this morning. This is very serious. It will get worse before it gets better, and we can all do something about it. And what we can do is to maintain physical distancing. Governments can help people to do that by introducing these tough measures. But at the end of the day, every single one of us can make a difference. And I hope and believe and trust that that is what Canadians are doing. As to whether further measures are being contemplated, of course they are. Everything is on the table.
I'll just add to that. Different jurisdictions are going to take different measures based on their own epidemiology and their own realities. And obviously, that is well within their jurisdiction to do that. But I will also say that where we know at the federal level we need to redouble our efforts to actually bring down the number of cases across Canada are on the things that Julie was asking about, contact tracing being one of them, which is why we're mobilizing hundreds and hundreds of people across the country to support provinces with that very onerous task. Some of those people are being deployed in Ontario right now who has put up their hand to ask for help, and we would encourage other provinces who need that support to reach out, because we will be increasingly having numbers to provide them of bodies and people that can help them with that work. Secondly, isolating people who are symptomatic. So we're working very diligently with provinces and territories on making sure that they have the capacity to isolate people who are ill, even mildly so. In some cases, people do have family homes in which they can isolate. In other cases, people do not. And so the work that's happening right now at the provinces and territories level is to find alternative accommodations to isolate people who may not have the ability to do that safely in a private residence. That will go a long way in reducing cases. So while provinces and territories and indeed the federal government take a variety of different measures to help prevent prevent close contact of people, and increased mobility that we know in some cases puts additional strain on systems. I think the practical steps of really doubling down on some of the recommendations of the World Health Organization are increasingly important, and that's where I, as the Minister of Health, have my attention focused on, is the practical things that can help provinces and territories right now understand who is ill, who they've had contact with, and how we ensure the isolation of those particular people who have come into close contact with the virus.
Thank you, Minister. We'll take 3 last questions on the phone and call it a day. Operator.
Thank you. Merci. The next question is from Philippe Vincent Foisy de Radio-Canada.
Philippe Vincent Foisy, Radio-Canada. Go ahead. Hi, Dr. Tam, Minister Duclos, you might be able to answer my question. Some things have been said about possible shortages of medical equipment and also about health systems which are not at all ready for a substantial surge and rising cases. Thank you for the question. Dr. New here. This is an ongoing issue. There could be a shortage of personal protective equipment. Minister Hajdu has already said that all levels of government are working together closely. And Dr. Tam and I are working very closely with our counterparts. We are working to get our hands on equipment all over the world. There is huge demand in the global market right now. We are also increasing domestic production of essential equipment. Made in Canada solutions. Our goal right now is to flatten the curve. Modeling shows us that if we do nothing, it will be a catastrophe. 30, 50, 60% of the population could contract the coronavirus, and so many people would need ICU care. And we want to avoid those worst-case scenarios. That's why measures like physical distancing are crucial. All Canadians need to continue to do their part, and that's necessary to flatten the curve. Hospitals and ICUs, hypothetically speaking, perhaps 1,000 people might need an artificial ventilator. But if all 1,000 had this need immediately within 1 week, that's different than having a need for 1,000 artificial ventilators over a few weeks, over a few months. That's the goal, to really flatten the curve, to flatten and stretch out needs. And health authorities in all provinces and territories are working with us. We're all working on preparation, on preparedness. We are working on temporary field hospitals, and we are calling back retired health professionals to help out in the healthcare system. And those who have other health conditions, we are looking at ways to care for them outside of hospital settings. We are working so hard on so many levels in order to avoid the worst-case scenarios. Follow-up question. Yes, but with all the modeling and forecasts, how long will this last? The Prime Minister said this morning that it could last through July, but it could also last much longer. In your predictions and your trend lines, your modeling at Public Health Agency of Canada, do you think it will last until July, or? Answer. It's too soon to tell. All Canadians are currently taking this seriously. Countless Canadians are practicing physical distancing. And here's what we're noticing with the epidemic curve. The cases that we're seeing appear now are cases where exposure occurred 2-3 weeks ago. We'll have to follow what happens in the next 2 or 3 weeks to see whether what we are doing now is having an effect. That's what we're going to be following closely. We cannot predict what will happen in 2 or 3 weeks. That's just not possible. I think it's best if we take things 1 week at a time. Let's focus on the fact that what we do this week will lead to good results in a week or two. That's what we should focus on. I'd like to add something. The priority is what we do now.
Will actually determine how long we are stuck in this space. And maybe Jean-Yves can translate this for me in French so I don't sound like a 7-year-old. But ultimately, at the end of the day, if we don't all act together and appropriately act and take the social distancing measures that public health has prescribed to us, make sure that we are physically distancing ourselves, listen to public health, all that does is lengthen the amount of time that will we be in this situation. In fact, one of the things that I read recently that I thought was fascinating was that if we all stopped moving for 2 weeks and nobody talked to anybody for 2 weeks and we all just stayed put, in fact, we would see this virus die. That is the reality. The virus needs hosts to continue to infect in order to continue to grow. And so how long we are in this actually depends on our actions today. Dr. Tam is too kind when she says that our actions today make the difference, because what she's not saying is that each of us is responsible for the length of time that this will take for these strict measures to be in place. And that if each of us can take the appropriate measures and show the self-discipline, staying at home, really only going out if absolutely necessary, when we're out walking, avoiding people, staying 6 feet away, waiting for the next elevator if there's another person on the elevator. Each of those things that we do today to practice appropriate social and physical distancing will shorten the duration in which we are stuck. So I will turn to Jean. Maybe you could translate for me.
Well, the message is very clear. And basically, if we didn't do anything, then the scenario would be a catastrophic one. But what's happening, though, is that a lot is being done. The Canadians and Quebecers are listening to instructions with regard to physical distancing and basic hygiene, hand washing, and quarantine for people coming back from abroad. And governments are working very hard as well, not only with regard to public health, also health care on the ground and frontline workers, but also what we saw yesterday with regard to the ability to produce medical equipment and provide it, because we're going to need that in the coming weeks.
Merci, Monsieur Duclos.
Thank you, Mr. Duclos. 2 questions on the phone. Operator, next question.
Thank you. Merci. The next question is Althea Raj from HuffPost Canada. Your line is now open. La parole est à vous.
Merci beaucoup.
Thank you very much.
Some questions about, Mr. Freeland talks about, and Mr. Trudeau talks about all the money basically being available, but there seems like there are obvious gaps in the system that has been announced so far. Self-employed people who have lost not all, but a significant drop in their incomes because of COVID-19 seem to not be included. And as we heard from Premier Legault last week, people who make minimum wage may not even make $2,000 at the end of each month. I know yesterday the Prime Minister talked about working with the provinces, but can you give us an idea of what exactly is envisaged to, these people are now essential workers, and everybody recognizes it, what is the federal government thinking of doing to ensure that these people are still showing up for work and they're not being financially disadvantaged compared to people who are staying home?
Do you mind, Althea, if we give Carla the first shot at it? She has joined us by video, so it would be good to hear.
Yeah, of course. Of course.
Thank you. Thank you. Can you hear me?
Yes, we can.
Excellent. Thank you. So with respect to anyone, Althea, who has only reduced hours or reduced income, they are not the target workers for the CERB. So we are looking at workers who have lost their income completely for COVID-related reasons, those are the workers that we want to cover by the CERB. Now, the wage subsidy, as Jean-Yves has said, details to follow very shortly through other ministers of finance and small business, is trying to address the larger cohort of workers who perhaps employers can't afford to keep on or employers have reduced hours for. With respect specifically to people who are self-employed, that is a population of workers that we are working to figure out where they fit in if their hours are simply reduced. If they have no income, they absolutely are eligible for the CERB. If your hours are reduced, we're trying to figure out how that works with how it interplays with other provincial options. But for right now, and the cohort that we're targeting through the CERB is in our workers who have no source of income.
And if I may, in addition to what Carla just said, the message from the Canada Revenue Agency, which I said in French, we can also repeat in English because it's something very important for Canadians to prepare for their demand for the Canada Emergency Response Benefit. And it is that to better prepare for the large expected inflow of demands that we expect for the new Canada Emergency Response Benefit, we are launching today the website, which is common for everyone, canada.ca/coronavirus-CERB. We're also asking Canadians to put in their demand starting on April the 6th for the emergency benefit according to their birth month. And that is for those born in January, February, and March. Application on April the 6th, application on April the 7th for those born on April, May, and June, April the 8th for those born in July, August, and September, and April the 9th for those born in October, November, and December.
Thank you, Minister. Althea, follow-up?
Yeah, nobody actually responded to the minimum workers. What exactly is the federal government working towards when the Prime Minister says it's working with the provinces in terms of ensuring that those individuals who are working full time are at least making take home $2,000. And if I could just add as a follow up, has any thought been given to giving the families of, unfortunate as they may be, medical workers who end up dying because of COVID-19 death benefits as we give to Canadian Forces members?
Carla, would you want to answer on the minimum wage and workers?
So thank you. Yep, I can. Thanks, Jean-Yves. So again, we recognize, and we didn't in any way want to disincentivize or in any way reduce the value and the contribution of people who work in essential service industries, but also who get minimum wage. We're working to figure out a way to recognize the important contributions they're making, whether that be through employer top-ups or through other means. As the Prime Minister said, that's a conversation happening collaboratively with the provinces as we try to harmonize our benefits to make sure that there aren't these gaps. Of course, as you can appreciate, we're doing public policy work that may historically have taken years in a matter of days, and as new groups are identified that necessarily aren't that haven't yet been fit into any of these benefits, we're working on that. Everything is up for grabs, is what I'm saying.
Thank you, Minister. Maybe one last question on the phone.
Thank you. Merci. The next question is from Lina Dib, La Presse Canadienne. Please go ahead. La parole est à vous.
Oui, bonjour. J'aimerais revenir sur
Question.
la pénurie de masques
Hello.
au Québec.
I'd like to come back to the shortage of masks in Quebec. I would like to get a clear answer. This morning, Mr. Trudeau said that right now, in a very short time, masks would be delivered to Quebec from Ottawa's stockpile. But a few minutes ago, Minister Haidu gave a more nuanced answer. So could I have confirmation confirmation. Will Quebec receive masks from Ottawa within the next 2 days? Answer. I can confirm that yes, that is the case. Thank you. Thank you for your clear and short answer. My next question is this. You said from the beginning that it's absolutely essential for supply chains be left open with the United States because there is medical equipment coming from the U.S. and not just with regard to COVID-19. But I wonder, have you received recent guarantees from the Trump administration, given what's going on there with the 200,000 cases there? Have you received guarantees from the Trump administration that medical equipment will continue to be sent to Canada, be it for COVID-19 or for any other medical necessities? Answer. We discuss the relationship between the United States and Canada daily. We discuss trade issues between Canada and the U.S. every day. And we discuss the health situation in Canada and in the United States on a daily basis. So no guarantees. Thank you, Minister.
Thank you. Merci. Ceci me fait à la conférence de presse.
That concludes the press conference.
Okay, and that is our federal wrap of press conferences by both the Prime Minister, the Deputy Prime Minister, and other cabinet ministers and public health officials today. A couple of bits of news for everyone to keep in mind. Parliament will be recalled in the days ahead to deal with what the government is qualifying as the biggest economic program the government or a government has ever put in place. And that, of course, has to do with the wage subsidy and the emergency relief benefit. The other piece of news you should keep in mind is that portal, that website, if you qualify for the $2,000 a month, is now open, and they will start to accept those applications next Monday. I've tweeted out that link, and we'll put it up on our website and on the screen throughout the day as well. And I think that's it from what we got from the federal government for now. Of course, we will have lots of coverage from provinces through the day and across the country as they become available. I will say goodbye for now, and I'll see you tomorrow. My colleague Andrew Nichols will take over, but now let us bring you the update from Ontario and Premier Doug Ford speaking to Ontarians right now. See you tomorrow.
COVID-19. And actually, I'll pass this one over to Minister Elliott, and she'll give you more information on that.
Well, this is something that we've only become more recently aware of as a concern, but Dr. Williams has issued a directive today, issuing his strong recommendation that the local medical officers of health use their powers under Section 22 of the Health Protection and Promotion Act to require that people who have been diagnosed with COVID-19 maintain that status and stay in self-isolation. This is going to be followed up on by the local medical officers of health, and there are significant fines for people to not do that. But I think the most important thing is that they will be followed up with their local medical officers of health to make sure that they are continuing that self-isolation.
Next question.
The next question comes from Haley Cooper from News Talk 1010. Please go ahead.
Good afternoon, Premier. We've had Rob and Cynthia and Colin now ask about modeling and projections, and I was going to ask myself, and we still haven't been given any numbers. So why does it appear the government is hesitating in giving those numbers? You know, people know that this is a fluid situation, but they also want to know, you know, worst case scenario, what is the province looking at? So why is the government not giving the numbers that it's seen?
Well, as the Minister of Health mentioned, there's different models. There's a few different models, and if we pick one model over another, it sends really two different messages. Our message is very clear. We're going through some turbulent waters over the next few weeks, and we need to do everything we can to make sure that people self-isolate. We've been saying it over and over again every single day, because those models can drastically change. If we underestimate on one side and we overestimate on the other, and create a panic if we overestimate. But the facts is very clear. we're going through turbulent waters. We've been saying it over and over again. Make sure that you don't congregate. Last weekend, it was a little shocking to all of us that we see parks and beaches packed. We acted immediately, making sure that we brought through an order to make sure we close the parks and close the beaches. I don't know what more we can say outside of stay in your home, self-isolate when you can, go out one person at a time to go get your groceries. And if you have seniors, your parents are seniors, or if you're grandparents, make sure they stay inside. Anyone over the age of 70, stay inside. We just can't, we can't emphasize it enough.
And so the worst case scenario, the numbers that you have seen, are they worse than what you were expecting? Do you think that Ontarians will hear the number and think that it's worse than what they were expecting?
No, the worst case scenario can get bad. We were saying, and we've been very clear, we can have two ways to go here. We go the route of Italy and Spain, and we see the numbers over there, or we can take the other route, South Korea and Germany. And we all want to go the route South Korea has gone, making sure that people self-isolate. They don't spread the virus. As I said earlier on, the virus doesn't spread itself. It spreads being on people. And the further we can keep away and social distancing, practice that, the quicker we're going to get through this.
Okay, this will be the last question.
Last question comes from Marata and Thistle from Global News. Please go ahead.
Hi, thank you for taking my question. So, Premier, we're hearing from people with loved ones at long-term care homes that are experiencing outbreaks that even though their family members are not testing positive for COVID-19, they're not allowed to take their family members out of these facilities to self-isolate with home care. And some people have said, you know, they're worried about their family members. There's one case where someone actually did become positive after their family was not allowed to remove them from the home. So I'm wondering, is this an order that they can't leave the long-term care homes to get care away from places where there's an outbreak?
Well, again, we put that order in that people can't go and visit their loved ones. I understand the question that they want to take them out. I'm gonna again pass this over to Minister of Health, and then I have a follow-up after this.
I think that what was happening before was family members were coming to the homes, taking their family member out, maybe taking them home for dinner or taking them somewhere else, and then bringing them back. That's why we've changed the rules so that people aren't allowed to leave the home. However, if family members want to take their loved one and have them join them, and stay with them, of course, they'll have to be cleared for COVID-19 before that happens, because we don't want them infecting their family. And if they want to do that, they can do that, but then they can't come back in during while COVID-19 is still with us. So I think what we were really trying to stop happening was a situation where family members were being taken out just for the day and returned.
Follow up?
Yeah.
And you this is the Premier, or unless you had a follow-up to the...
No, I was just going to follow up and speak, but if you have a follow-up question on health, I can bring the Minister back up.
Oh, no, this one was actually for you, Premier, so if you want to go ahead and finish your answer, go ahead.
Oh, no, it's a separate item, please, if you have another question.
Okay. Well, this is also along the long-term care industry. We've heard from workers that they're actually being forbidden from wearing masks on shift. And so when we asked Dr. Yassi and Dr. Williams about this, they said the policy of it being mandatory for all healthcare workers in long-term care facilities to wear masks was under review. So I'm wondering, Premier, are you prepared to override Dr. Williams' directive if you're hearing from frontline healthcare workers that they do not feel safe on the job?
Well, I've been saying from day one, I take the advice of the Chief Medical Officer of Health and our health professionals. I understand it's difficult. personally, and I don't overrule. Again, I want to stress this. I listen to the health professionals. Are you safer with a mask? Absolutely, you're safer. I can't stand up here and say you wouldn't be safer without a mask. So in my opinion, you'd be safer with a mask. But again, I'm going to stick with the advice from the Chief Medical Officer of Health and the health professionals that give me advice.
Okay, thank you.
I just, throughout this this time, I come up here and I talk about the Ontario spirit. The Ontario spirit, the companies around this great province are stepping up. I got a phone call the other day from the president of International Brands, a great company up in Newmarket. His name is Mark. Usually don't give last names, so I'll just say Mark, the CEO up there, called up and said, Premier, we have a donation for the province. And this is a big donation, 40,000 bottles of hand sanitizer. He says, I have 10 skids. Where do they go? This is what I'm talking about, companies stepping up. I was on a phone call today in one of the radio stations out by Bruce County, and Bruce Power, the CEO, got on and said they're donating 600,000 PPE, essential items, be it medical gowns, face masks, gloves, hand sanitizer. That's probably one of the largest donations we've had from Bruce Power. We thank you. And I have to say, keep it coming, because with the power that these companies have, we're an economic powerhouse around the world. They're stepping up and supporting the cause. Another shout out that I want to do that doesn't get very much recognition at all, but shows up every single day to help with sign language is Christopher behind me. And Christopher, do you have a minute for just to come up here for 1 minute? I apologize. You can take over the sign language, but this gentleman shows up, never complains, never says a word. And I told him today how many comments and emails and phone calls I get about you. My friend, you're a champion, you're a rock star, helping people in the deaf community. And it's so important, the role you're playing. And I was told today that moving forward, you're no longer going to be with us physically here, but you'll be with us as a team. Is that right?
Yes. Yeah.
Great. Yeah, go ahead, please.
Absolutely. So I will still be part of the team, and I may be behind the cameras and supporting the interpreters that are here. But what we're trying to do is we're trying to make sure that all deaf Ontarians have access. And we're moving to include deaf interpreters. And deaf interpreters make sure that including deaf children and deaf adults and everybody can understand the message clear to keep themselves safe from COVID-19 and be able to follow the very important messaging that Premier Ford is sharing with us. So we will be changing a little bit, but I will still be in the building.
Well, thank you so much for your service. People like this, like Christopher, real champion, stepping up, never complaining, day in and day out. One more shout out. The people that work in financial institutions. You're going in there, we haven't mentioned them yet, but they're dealing with you day in and day out, making sure that the economy is flowing, the money is flowing, and they're sitting there at the teller's booth, and I want to thank them as well, and thank all Ontarians. Thank you, and God bless. Thank you so much, folks.
And that was the Premier of Ontario, Doug Ford, along with ministers. Hello, I'm Andrew Nichols. We heard from the Ontario Premier saying he was asked specifically about some of the modeling that we have heard, especially with some of the numbers, the shocking numbers coming out of the United States in terms of the number of people who could die. And the Premier did not specifically say what number we could be looking at in the province of Ontario, but we do know some specific numbers, that there are 2,400 cases of COVID-19 in Ontario, 41 deaths, 10,000 ventilators have been ordered. And he said,